ದಿನದಂತೆ ಎರಡನೇ ಶುಕ್ರವಾರ ದಿನ ನಾವು ಈ ದಿನ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಪ್ರೋಗ್ರಾಮ್ ಅಂಗವಾಗಿ ಇವತ್ತಿನ ದಿನ ವಿಶೇಷವಾಗಿ ಅದು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಮಹಿಳಾ ದಿನಾಚರಣೆ ಅಂಗವಾಗಿ ನಾವು 3 ಪ್ರಸಿದ್ಧ ಮಹಿಳೆಯರನ್ನ ಈ ಸಭೆಗೆ ನಾವು ಕರೆದಿದ್ದೇವೆ. ಅವರಿಗೆ ಸ್ವಾಗತ ಮತ್ತು ಸುಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತಾ ಇವತ್ತಿನ ಈ ಇಂಪಾರ್ಟೆಂಟ್ ಆದಂತ ಈ ಒಂದು ದಿನದ ಅಂಗವಾಗಿ ನಾವು 3 ವಿಶೇಷ ಉಪನ್ಯಾಸಗಳನ್ನ ಮಾಡಲಿಕ್ಕೆ ಅವರಲ್ಲಿ ನಾವು ವಿನಂತಿ ಮಾಡಿಕೊಂಡಿದ್ದೀವಿ. ಅದು ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಮೇಡಮ್ ಅವರು ಅವರ ಕೋರಿಕೆಯ ಮೇರೆಗೆ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಏರ್ಪಡಲಾಗಿದೆ. ಅವರು ಕೂಡ ನಾನು ಸ್ವಾಗತ ಮತ್ತು ಸುಸ್ವಾಗತ ಕೋರುತ್ತಾ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಮ್ಮ IMA KSB ದ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ಶಿವಕುಮಾರ್ ಲಕ್ಕೋಳ್ ಸರ್ ಕೂಡ ಸ್ವಾಗತ ಮತ್ತು ಸುಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇನೆ. ಈ IMA ಸೀನಿಯರ್ ವೈಸ್ ಪ್ರೆಸಿಡೆಂಟ್ ಆದಂತ ಡಾಕ್ಟರ್ ರಾಜಶ್ರೀ ಅನಾರ್ಗೋಳ್ ಮೇಡಮ್ ಕೂಡ ಅವರು ಕೂಡ ನಾನು ಸ್ವಾಗತ ಮತ್ತು ಸುಸ್ವಾಗತವನ್ನ ಕೋರುತ್ತೇನೆ. ಅದೇ ತರನಾಗಿ IMA ಆನರರಿ ಡಾಕ್ಟರ್ ಕರುಣಾಕರ್ ಸರ್ ಅವರು ಕೂಡ ನಾನು ಸ್ವಾಗತ ಮತ್ತು ಸುಸ್ವಾಗತವನ್ನ ಕೋರುತ್ತೇನೆ. ಅದೇ ತರನಾಗಿ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿದಂತ ಎಲ್ಲ ಪ್ರೇಕ್ಷಕರಿಗೂ ಮತ್ತು ಈ ಕಾರ್ಯಕ್ರಮದ ಇವತ್ತಿನ ಚೇರ್ಪರ್ಸನ್ ಆಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ವೀಣಾ ಎನ್ ಮೇಡಮ್ ಅವತ್ತು ಅವರು ಯಾವುದೇ ಪ್ರೋಗ್ರಾಮಕ್ಕೆ ನೆಗೆಟಿವ್ ಅಂದಿಲ್ಲ. ಸೊ ಎಲ್ಲ ಪ್ರೋಗ್ರಾಮ್ಗೆ ಅವರು ಬಂದಿದ್ದಾರೆ. ಈ ಕಾರ್ಯಕ್ರಮ ಕೂಡ ನಾನು ಹೇಳಿದ ನಂತರ ಅವರು ಸ್ವಸಂತೋಷದಿಂದ ಅವರು ಕೂಡ ನಾನು ಸ್ವಾಗತ ಸುಸ್ವಾಗತ ಕೋರುತ್ತಾ ಇವತ್ತಿನ ಎಲ್ಲ IAKSB ಅಧಿಕಾರಿಗಳಿಗೆ ಹಾಗೂ ಎಲ್ಲಾ ಮೆಂಬರ್ಗಳಿಗೂ ಈ ಕಾರ್ಯಕ್ರಮ IMA KSB ಈ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಪ್ರೋಗ್ರಾಮ್ ಇವತ್ತೇ ನಡೆಸ್ತಾ ಇದ್ದೀವಿ ಅವರೆಲ್ಲರಿಗೂ ಕೂಡ ನಾನು ಸ್ವಾಗತ ಸುಸ್ವಾಗತ ಕೋರುತ್ತಾ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ಪ್ರಾರ್ಥನೆ ಡಾಕ್ಟರ್ ಕರುಣಾಕರ್ ಸರ್.
Thank you so much, respected President sir, Chairman of the committee, and all the honorable members and esteemed members of IMA KSB. It's an honor to do IMA prayer on behalf of the program. So I go ahead with the prayer and we don't really waste time on that. ಕನ್ನಡದಲ್ಲೇ ಮಾಡ್ತೀನಿ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ. ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಲಿ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯುವಾಗಲಿ. ಧನ್ಯವಾದಗಳು. ಇಟ್ಸ್ ಬ್ಯಾಕ್ ಟು ಯು ದ ಚೇರ್ ಅಂಡ್ ದ ಟೀಮ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್.
Thank you very much, sir. Thank you. Now we'll go to the next the speakees by IMA KSB President Dr. Shivakumar Lakkol sir.
Okay, sir. Thank you sir. Can you hear me sir? ಕೇಳುತ್ತಲ್ಲ ಸರ್?
ಸರ್ ಕೇಳಿ ಸರ್.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ರಾಜ್ಯ ಶಾಖೆ ಹಾಗೂ ವುಮನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗಿನ ಸಹಯೋಗದೊಂದಿಗೆ ಅಲ್ಲದೆ ಮತ್ತು ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಅವೇರ್ನೆಸ್ ಇದರ ಸಹ ಅಡಿಯಲ್ಲಿ ಮಹಿಳಾ ದಿನಾಚರಣೆಯ ಅಂಗವಾಗಿ ಹಮ್ಮಿಕೊಂಡಿರ್ತಕ್ಕಂಥ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಿಮಗೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ. ನಮ್ಮ ರಾಜ್ಯ ಶಾಖೆಯ ಕಾರ್ಯದರ್ಶಿಯಾದ ಕರುಣಾಕರ್ ಅವರೇ ಹಾಗೂ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಕಮಿಟಿಯ ಚೇರ್ಮನ್ ಆಗಿರ್ತಕ್ಕಂಥ ಕರಿಗಣ್ಣ ಅವರೇ ಹಾಗೂ ಕನ್ವೀನರ್ ಆಗಿರ್ತಕ್ಕಂಥ ಸುರೇಶ್ ಅವರೇ ಹಾಗೂ ವುಮನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗಿನ ಚೇರ್ಮನ್ ಆಗಿರ್ತಕ್ಕಂಥ ಮನ್ಪ್ರೀತ್ ಕೌರ್ ಅವರೇ ಹಾಗೂ ನಮ್ಮ ರಾಜ್ಯ ಶಾಖೆಯ ವೈಸ್ ಪ್ರೆಸಿಡೆಂಟ್ ಆಗಿದ್ದಂತ ರಾಜಶ್ರೀ ಅನಗೋಳ್ ಮೇಡಮ್ ಅವರೇ, ವೀಣಾ ಮೇಡಮ್ ಅವರೇ ಹಾಗೂ ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮದ ರೂವಾರಿಗಳು, ಉತ್ತಮವಾದಂತ ವಾಗ್ಮಿಗಳು ಆಗಿರ್ತಕ್ಕಂಥ ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಅವರೇ ಹಾಗೂ ಲೀಗಲ್ ಆಸ್ಪೆಕ್ಟ್ ನಲ್ಲಿ ಮಾತಾಡಿ ಬಂದಿರತಕ್ಕಂಥ ದೀಪಾ ಮೇಡಮ್ ಅವರೇ. ಈಗ ನಮ್ಮ ಮನ್ಪ್ರೀತ್ ಕೌರ್ ಅವರು ಸರ್ವಿಕ್ಸ್ ಇನ್ ವುಮನ್ ಅಂಡ್ ಗರ್ಲ್ಸ್ ಅನ್ನೋ ಒಂದು ವಿಷಯದಲ್ಲಿ ಮಾತಾಡ್ತಾರೆ. ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಅವರು ವುಮನ್ಸ್ ಅಂಡ್ ಹೆಲ್ತ್ ಇನ್ ದ ಸೊಸೈಟಿ, ಹಾಗೆ ಲೀಗಲ್ ಆಸ್ಪೆಕ್ಟ್ ಪರಿಣಿತರಾಗಿರ್ತಕ್ಕಂಥ ಅಡ್ವೊಕೇಟ್ ಆಗಿರ್ತಕ್ಕಂಥ ದೀಪಾ ಮೇಡಮ್ ಅವರು ಲೀಗಲ್ ರೈಟ್ಸ್ ಆಫ್ ವುಮನ್ ಇನ್ ಇಂಡಿಯಾ. ಒಳ್ಳೆಯ ಟಾಪಿಕ್ ಬಗ್ಗೆ ಇವತ್ತು ಕಾರ್ಯಕ್ರಮವನ್ನು ಹಮ್ಮಿಕೊಂಡಿದ್ದ ಎಲ್ಲ ನಮ್ಮ ರಾಜ್ಯ ಶಾಖೆಯ ಪದಾಧಿಕಾರಿಗಳಿಗೆ, ಗೌರವಾನ್ವಿತ ಎಲ್ಲ ವೈದ್ಯ ಮಿತ್ರರಿಗೆ ನನ್ನ ಅನಂತ ಧನ್ಯವಾದಗಳು. ಎಲ್ಲ ಕಾರ್ಯಕ್ರಮವು ಯಶಸ್ವಿ ಆಗಲಿ. ಮತ್ತೊಮ್ಮೆ ವುಮನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗದ ಅಡಿಯಲ್ಲಿ ನಡೀತಕ್ಕಂಥ ಹಾಗೂ ವುಮನ್ ಡಾಕ್ಟರ್ ಪರವಾಗಿ ಎಲ್ಲರಿಗೂ ಮತ್ತೊಮ್ಮೆ ನನ್ನ ಶುಭ ಕಾಮನೆಗಳನ್ನ ತಿಳಿಸುತ್ತಾ ಕಾರ್ಯಕ್ರಮವನ್ನು ಮುಂದುವರಿಸಿಕೊಳ್ಳಲು ಸುರೇಶ್ ಕಾಗಲ್ಕರ್ ಅವರಿಗೆ ಕೇಳಿಕೊಳ್ತೇನೆ. ನಮಸ್ಕಾರ. ಹೇಳ್ತಲ್ಲ ಸರ್ ನಮ್ಮ ಮಾತಾಡೋದು?
ಸರ್ ಧನ್ಯವಾದಗಳು.
ಥ್ಯಾಂಕ್ ಯು.
ಧನ್ಯವಾದಗಳು ಸರ್, ಧನ್ಯವಾದಗಳು.
ನಾವು 1 hour ದಾಗ ಸರ್, ಹಿಂಗಾಗಿ ಕಮ್ಯುನಿಕೇಶನ್ ಸ್ವಲ್ಪ ಕಡಿಮೆ ಆಗ್ತಾ ಇದೆ. ಥ್ಯಾಂಕ್ ಯು.
ಓಕೆ ಸರ್, ನಾವು ಪ್ರೊಸೀಡ್.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
ಅದೇ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿದ ನಮ್ಮ IMA KSB ಯ ಉಪಾಧ್ಯಕ್ಷರಾದಂತ, ಮಹಿಳಾ ಉಪಾಧ್ಯಕ್ಷರಾದಂತ ಡಾಕ್ಟರ್ ರಾಜಶ್ರೀ ಮೇಡಮ್ ಅವರ ಮೇಡಮ್, ರಾಜಶ್ರೀ ಮೇಡಮ್.
Yes, sir. Good evening to one and all, and happy International Women's Day to all the members who are present here. I welcome you all for this webinar on the public forum health. Today, actually, I congratulate all of these organizers, Dr. Arvind sir and convener Dr. Suresh sir, for selecting the eminent speaker for this today's webinar. And these 3 women, they are going to enlighten us on the public health issues. I welcome Dr. Manpreet Kaur Vijaypur, the IMA KSB WWW chairman, Dr. Padma Prakash, she is a neonatologist and pediatrician from Bangalore, and Mrs. Deepa, advocate from Bangalore. And the Honorary Secretary, Dr. Karunakar sir, and all the members who have joined for this webinar. Once again, I welcome you all for this today's webinar. Thank you, one and all.
Thank you.
ಥ್ಯಾಂಕ್ ಯು. ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ನೆಕ್ಸ್ಟ್ ವೀಣಾ ಮೇಡಮ್ ಅವರ ಬಗ್ಗೆ, ಅವರ ಪರಿಚಯ ಬಗ್ಗೆ ಎಲ್ಲರಿಗೂ ಗೊತ್ತಿರತಕ್ಕಂಥದ್ದು. ಅವರು ಒಬ್ಬರು ವೈದ್ಯರು, ಗೈನಕಾಲಜಿಸ್ಟು, ಸೀನಿಯರ್ ಗೈನಕಾಲಜಿಸ್ಟ್ ಸುಳ್ಳೆ. ಅವರು ವೈದ್ಯರಷ್ಟೇ ಅಲ್ಲ, ವೈದ್ಯ ಸಾಹಿತಿಗಳು. ಅನೇಕ ಕೃತಿಗಳನ್ನ ಬರೆದಿದ್ದಾರೆ ಮತ್ತು IMA ವೈದ್ಯ ಬರಹಗಾರರ ಪದಾಧಿಕಾರಿಗಳು ಕೂಡ. ಮತ್ತು ಅವರು ಒಬ್ರು ವಾಸವಿ ಸಾಹಿತ್ಯ ವೇದಿಕೆಯ ವತಿಯಿಂದ ಪ್ರತಿ ವಾರಕ್ಕೊಮ್ಮೆ, ಪ್ರತಿ ರವಿವಾರ ತನ್ನದೇ ಆದಂತ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ IMA KSB ಅಡಿಯಲ್ಲಿ, ವೈದ್ಯ ಬರಹಗಾರ ವೇದಿಕೆಯ ಅಡಿಯಲ್ಲಿ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ನಿರಂತರವಾಗಿ ಹಮ್ಮಿಕೊಂಡು ಬರ್ತಾ ಇದ್ದಾರೆ. ಅಂತ ಒಬ್ಬ ಸಾಹಿತಿ, ವೈದ್ಯರು, ನಾಟ್ಯಗಾರತಿ, ಸಂಗೀತಗಾರರು, ವೈದ್ಯರು ಚೇರ್ಪರ್ಸನ್ ಆಗಿ ಒಪ್ಕೊಂಡಿದ್ದಾರೆ. ವೀಣಾ ಮೇಡಮ್ ಕೂಡ ಸ್ವಾಗತ ಸುಸ್ವಾಗತ. ತಾವು ನಡೆಸಿಕೊಳ್ಳಿ 2 ಮಾತುಗಳು ಹೇಳ್ತೀವಿ ಮೇಡಮ್. ವೀಣಾ ಮೇಡಮ್,
ನಿಮ್ಮ ಪ್ರೀತಿಯ ಮಾತುಗಳಿಗೆ ಧನ್ಯವಾದಗಳು. ಕಾರ್ಯಕ್ರಮವನ್ನ ಮುಂದೆ ನಾವು ನಡೆಸೋಣ. ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಫಾರಂನ ವೇದಿಕೆಯಲ್ಲಿ ನಾವು ಇವತ್ತು 3 ಭಾಷಣಗಳನ್ನ ಕೇಳಲಿಕ್ಕಿದ್ದೇವೆ. ಒಂದು ಕ್ಯಾನ್ಸರ್, ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್, ಹೇಗೆ ಅದನ್ನ ಪ್ರಿವೆನ್ಷನ್ ಮಾಡ್ಬೋದು, ಹೌ ಟು ಪ್ರಿವೆಂಟ್ ಕ್ಯಾನ್ಸರ್ ಸರ್ವಿಕ್ಸ್ ಅಂತ. ಇನ್ನೊಂದು ಮಹಿಳೆಯ ಆರೋಗ್ಯ ಮತ್ತು ಸಮಾಜ ಅನ್ನುವಂಥದ್ದು. ಇನ್ನೊಂದು ಭಾರತದಲ್ಲಿ ಮಹಿಳೆಗೆ ಇರುವಂತಹ ಹಕ್ಕುಗಳು. ಇವುಗಳ ಬಗ್ಗೆ 3 ಭಾಷಣಗಳನ್ನ ನಾವು ಇವತ್ತು ವ್ಯವಸ್ಥೆ ಮಾಡಿದ್ದೇವೆ. ಮೊದಲಿಗೆ ಮನ್ಪ್ರೀತ್ ಕೌರ್ ಮೇಡಮ್ ಅವರನ್ನ ನಾನು ವೇದಿಕೆಗೆ ಆಹ್ವಾನಿಸ್ತಾ ಇದ್ದೇನೆ. ಅವರ ಬಗ್ಗೆ ಅವರ ಪರಿಚಯವನ್ನ ಮಾಡ್ಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೇನೆ. 1994ರಲ್ಲಿ ಗವರ್ಮೆಂಟ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಪಟಿಯಾಲದಲ್ಲಿ MBBS ಅನ್ನ ಮಾಡಿ 1997 ಅಮೃತ್ಸರ್ ಗವರ್ಮೆಂಟ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ನಲ್ಲಿ MD OBG ಅನ್ನ ಮಾಡಿದವರು. 22 ವರ್ಷಗಳ ದೀರ್ಘ ಅಧ್ಯಾಪನವನ್ನ ಮಾಡಿದ್ದಾರೆ. BLDE ಯೂನಿವರ್ಸಿಟಿ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ನಲ್ಲಿ ಪ್ರೊಫೆಸರ್ ಆಗಿದ್ದು, ಆಲ್ ಅಮೀನ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ವಿಜಯಪುರದಲ್ಲಿ OBG ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಲ್ಲಿ HOD ಆಗಿದ್ದವರು. ಆಮೇಲೆ ಮೆಡಿಸ್ಕ್ಯಾನ್ ಸೆಂಟರ್ ಚೆನ್ನೈನಲ್ಲಿ ಅಲ್ಟ್ರಾಸೌಂಡ್ ನಲ್ಲಿ ತರಬೇತಿ ಪಡೆದವರು. ಡಯಾಬಿಟಿಸ್ ಮತ್ತು ಇಂಡಿಯನ್ ಮೆನೋಪಾಸ್ ಸೊಸೈಟಿ ಸರ್ಟಿಫೈಡ್ ಕೋರ್ಸ್ ಅನ್ನ ಮಾಡಿದವರು. WDW ವುಮೆನ್ಸ್ ವಿಂಗ್ ನ ಚೇರ್ಪರ್ಸನ್ ಆಗಿರುವವರು. ಈಗ ನಮ್ಮನ್ನ ಉದ್ದೇಶಿಸಿ ಮಾತಾಡ್ಬೇಕು ಅಂತ ಎಲ್ಲರ ಪರವಾಗಿ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೇನೆ. ಸ್ವಾಗತ, ವೆಲ್ಕಮ್ ಮೇಡಮ್.
Thank you, ma'am. Thank you so much for your kind words, madam. I'll start my talk. Ma'am, sir, if your permission is there, can I start the talk? Okay.
sir.
Okay. A very good evening to everybody. Today, I thank IMA KSB and I thank the Public Forum Committee And I thank the convener. The luck calls are most important. I thank sir for giving me this opportunity to be able to spread this very important message that all women should be aware that cancer cervix is a life-taking cancer, not life-threatening also. It just takes away the lives of women. And not only women should be aware of how to prevent and protect ourselves from it, but also the men in our lives or in the lives of all the women of this world should know how to protect their mothers, wives, daughters from this cancer. So this is not a talk just for the women. This is a talk for everybody who care about another person in their lives, and it's a woman. So now, cervical cancer and its prevention. Today, I will just talk about, because this is a public forum and we are expecting a lot of non-medicos. So I'll just go a little slow, and I will also try to speak in as much of a simple language as possible. And if there are some questions, of course, we will have a question hour in the end and I will answer the questions. So I'm going to be talking on what is the cervix, what is cervical cancer, why is this important, what causes this cancer, what are the symptoms of cervical cancer, that in case a woman or I or anyone has these symptoms, when I should, go to a doctor and get myself checked, even if it is a false alarm. Even if I don't have the disease, getting myself checked is a good thing to do, because if the disease is caught at an earlier stage, it is definitely better than having an advanced malignancy. Then how is it treated? What are the related diseases to cancer cervix? How can one protect oneself from this cancer? And what should every woman know about how to catch this cancer before the symptoms appear? That is called screening. Screening is taking tests in an asymptomatic woman. Andre, symptoms chalu agirangilla, but avaganu at a timely basis, say 3 hourly, 3 yearly or 5 yearly, we should go get ourselves checked and get a simple test done, which can tell me that either I am free from the disease or I have a disease which can go on to develop into cancer, or I have the cancer itself. And then the earlier, as I said, the earlier we suspect it or the earlier we catch it, the better it is. Then what I should know about vaccination, most important, that is the only thing that can prevent this cancer from happening to us. So now you see this. Okay.
And you can go full screen.
Yes. Sorry?
Full screen.
I am on full screen actually.
So for us, it's open. It is still not in slideshow.
So, press the slideshow, ma'am.
No, actually on my laptop.
Continue, ma'am. No, you go for the next slide.
Or else you go for the next slide. Because your network also is.
Is it
No, yeah. Okay.
now full
Yeah.
screen? Okay.
Not full screen, second slide.
But it's okay. You can carry on.
You talk, ma'am.
We'll just continue because there is.
Yeah.
Sure.
Okay, so now this is the uterus. I'll just highlight it. This is the uterus. And this is the opening to the uterus. Here, if you see the small red pointer. So this is where the cervix cancer will start. And we are going to talk about how to prevent the cancer from occurring. So this is the opening to the uterus. This should not be mistaken from the vagina, because vagina is the area which is below the cervix. But the cervix, when we examine a patient or a gynecologist examines a patient, this cervix is very much visible through the vagina, and any growth on the cervix can be easily made out on examination. Now, what is cancer? Now, when I talk about normal cells, these cells are always multiplying. When they become old, they will die and they will fall off, and new completely formed mature cells replace them. They take over the regular function of the normal cells. But what happens in cancer? In cancer, the normal becomes abnormal.
Ma'am, sorry to disturb.
Yes.
The slides are not. We are with the slide. What is cervix?
Now,
No, you have to close and share it.
Okay.
Yeah, it's come now.
Now it's.
Third slide has come.
Okay. Is this visible, sir? Is it visible now?
It is visible, ma'am. Try changing for next one. We'll see if it's.
Now I changed actually for the next one.
Third is come.
This one.
We can see a slide. What is cervical cancer?
But you cannot see the images.
No, it has come. No,
It has
Images
come.
also.
go for the fourth slide, madam.
Okay, cancer that affects the mouth of the uterus has come now.
Yeah, it has come. It has come. Next slide. you
Now,
press.
now, no.
This- Third slide.
I'll just go to, now is it visible?
It is visible, madam. Yeah.
Yeah.
Okay. So I'll present like this only. I think. I'll present like this. So old cells, now when cancer becomes abnormal, when the normal cell becomes abnormal, the growth is uncontrolled, multiplication of the cancer cells is uncontrolled. Old cells refuse to die and new cells keep growing. This becomes a bulk called a tumor. So this is how a cancer tumor or a cancer gunt, this starts. So this can spread and grow anywhere else in the body and choke off the normal cells, example in the brain, in the lungs and the livers. And this is how advanced cancer takes place. And is the slide visible?
Yes, sir. Go ahead.
Okay. Now cancer that affects the mouth of the uterus is cervical cancer. It starts with a lesion or a growth which is not malignant, but it is in danger of turning into a malignant cell. So we call it the pre-malignant stage, then early stage, mid stage, and late stage of cancer. This is what normal cervix looks like. But once the changes have started taking place, this is how the growth of the cervix will look like. Now, these are all images of when a cancer develops on the cervix or the mouth of the uterus. Now, why is it that I should, or everyone should know about the cervical cancer is because 67,477 new cervical cancer deaths, not new cases, deaths from cancer cervix occur annually in our country. It is the second most common cause of women or female cancers in India. And cervical cancer is also the second most common cause of cancer deaths in women aged 35 to 45 years in India, and then 50 to 55. We have two peak ages of cancer cervix. We should not think now, because some of us, or we may be thinking, no, when I grow old, I will get a cancer. This is not it, because cancer cervix is a type of malignancy which affects a very young age of women too, that is 35 to 45 years. When the woman is young and the kids are also young, it's a very young family. And then, yes, when old, the second peak comes at 50, 55. So it's not that only old women with symptoms should go and get checked. Even women without symptoms in an early age at 30, 35, 40, 45, we should go and get ourselves checked for cancer cervix. We should remember that 185, almost nearly 200 women every day die of cancer cervix in our country. That means by the time that we finish with this public forum, 8 women will have died from cancer cervix. That is a huge, huge number. And we can prevent this really fatal malignancy by a simple step, that is vaccination, which I'll be talking about. So how is this cancer cervix caused? It is caused by a virus. So now we have two things which are in favor of us being able to prevent this cancer. Number one is that the cervix is very much visible to the examining eye, and any gynecologist can see this, or any person who's trained in looking at the cervix can look at the cervix and see any abnormality in it. And number two, it is caused by a virus. And viruses, as you know, it is a living organism, and we have treatment for that virus. So prevention can be made against this virus. Now, what does this virus do? not only causes malignancy, more than 75% of the cervical cancers are caused by, there are different types of this virus, serotypes we call them. So more than 75% are caused by the 16 and 18, and then 6 and they cause 90% of the anogenital warts. Now, what is this anogenital warts that I have brought into the cervical cancer is, these are growths which look like this. You know, there are 3 or 4 examples. This is a growth on the male external genitalia, and this is an anal perianal area. So these are the growths which are not themselves malignancy, but this show that if I have this anywhere on the body, which can be on the hands, on the feet, anywhere, then this is an HPV infection, that is human papilloma infection, which if it reaches the genital area is going to be responsible not only for the female genital cancer, that is cervix, but also cancers in the male and also cancer of the anus. So we have to be, all of us need to be careful about this virus. Now, genital warts, as I said, these warts are on the rise, and now almost 18% of the people who come to dermatology department have these warts, and it is a high percentage. Now, why are these? What I need to know about these HPV infections? All these warts are caused by HPV. All the malignancies are, CS cervix is caused by HPV. Now, what I need to know is that a large number of women get the HPV infection sometime during their lifetime, and by the age of 50, 80% of the women will have HPV in some form in our bodies. But there are no symptoms. We may not even know that this cancer, or this, sorry, not cancer as yet. We may not even realize that we have this virus. The majority would clear the infection without developing any disease. So if my immune system is good enough, now 80% of these women will just kill this virus in their bodies, and the virus will not have any further effect. But a few develop precancerous lesions and cervical cancer over a period of time, which can vary from a few months. In a few women, it may develop within a few months. In a few women, it may take up to 9 to 15 years, but we do not know which ones will have it. Initially, there was this thinking that only a certain class of women, that poor ladies or ladies with multiple sexual partners or ladies in a particular profession would be getting this. But now we have to change that mindset. It is not a malignancy or a cancer of a specific age group. It is not a malignancy of a specific profession. It is a malignancy, or it is a cancer that can affect any woman, and hence all women have to be aware of it. Now, HPV not only causes, as I said, it not only causes cancer of the cervix, it can also cause cancer of the vagina, of the vulva, then it can cause genital warts. Now, anal cancer can occur even in the males, can occur in the females also. Oropharyngeal cancer, that is cancer of the mouth, male as well as females are prone to it. Then penile cancer. So all these, so HPV causes more than just cervical cancer. Now, again, I said vagina. So this is the area below the cervix, and this is the area of the vagina. And the hairy part outside on the body is the vulva. Now, what are the symptoms of cancer cervix? Usually, as I said, there are no symptoms at all in the early stage. So that is why it is important that we should realize that I should not go to the doctor when I start developing symptoms. I should go to the doctor even when I'm asymptomatic, so that in case this cancer is there, it can be caught in the earlier stage. Now, when advanced, there can be the following symptoms. There can be little bleeding between periods, means irregular bleeding per vagina. Patient says that she gets her periods, and then in between also she has some spotting. Then there can be bleeding after sexual intercourse, which is a very suggestive thing for as a symptom of cancer cervix. Then abnormal vaginal discharge, especially foul smelling vaginal discharge, should be definitely gone and got checked up. Then sometimes there may be pain during intercourse, or there could be continuous type of pain in the lower abdomen or low backache. Then there could be unexplained weight loss, and there could be anemia, that is pale face, nails, and the patient starts feeling very weak, and dizziness and giddiness is there. So please do not wait for any of these symptoms to go get yourself checked. Get yourself checked before these symptoms occur. But in case these symptoms are there in you or in someone close to you, near to you, or the person who is known to you, please do not always suggest to them that they have to seek medical checkup as soon as possible. And it may be nothing at all, but if it is something, it should get caught in the earlier stages. Then the treatment options depend on the following: the stage of the cancer. So if it is an earlier cancer, the treatment is easier, the treatment is more complete. The size of the tumor, the woman's age, and the woman's desire to have children. Now, this should ring a bell that, see, it is not a disease only of the old age. It can occur in younger women also who have still not completed their families or who have not even had one child. Because nowadays, everybody, because in this career-oriented and education-oriented society that we have now, many women are deferring, many couples are deferring the first pregnancy because they want a brighter future, a better career, more education. So that's all right. But then women's desire to have children should not be curtailed by the fact that there is a malignancy somewhere in the body. Now, if it is an early stage, it is easy because we just burn the abnormal part of the area or we destroy it by freezing it. That's a painless procedure. But the best thing is that we can destroy the whole malignancy by doing just a small bit, and hence earlier the better. Then if it is a medium spread cancer, then we need to do surgery. But in that case, we need to remove the uterus, the cervix, as well as the tubes. The ovaries may have to be removed, and hence the stage, no more childbearing. And in the late stage, it is just life-saving procedures that we may have to do extensive surgeries and remove other parts of the body also. The patient may have to undergo radiotherapy, which is not very easy to take, then anti-cancer drugs, and survival in these cases becomes variable and it is not assured. So the earlier, the better again. Prevention, yes, and earlier, the better. That's okay. Can we protect ourselves from this disease? There is a big yes to this. Yes, we can. How can we protect? We should be aware that there is such a malignancy that can take place in a woman's body, and she can go get herself checked and she can stop this malignancy from occurring, or she can get it diagnosed at a very early stage. We can get ourselves vaccinated before this virus enters our body, and we can completely prevent this cancer. And then in case we have not got vaccinated, that's okay. We still have the way of preventing this cancer, and that preventing it from growing more and more, and that is by going for screening. So how to prevent this cancer? This is by taking the HPV vaccine. Vaccination is the only true form of prevention. We have to remember that. Nothing else. Nothing else. If we say no, not getting married, not having intercourse, using barrier contraceptives, no. The only true form of prevention is the vaccine. Now, how does this vaccine work? It gets into your body to produce antibodies. So there are some chemicals in the body which, if the virus enters, will destroy that virus. It is as simple as that. So I get vaccinated. I will get some chemicals in my body. Once that virus tries to enter my body, my body will destroy the virus by chemicals which are produced by this vaccine. It is as simple as that. Now, who should take the vaccine and when? Ideally, as early as possible after the age of 9. So we are recommending 9 to 15 years as the best age, because at this age, the chemicals which I said, the antibodies which are formed in the body are maximum antibodies. As the age advances, the chemicals will decrease, or the antibody formation will be a little less brisk. Now, but women of any age up to 45 can benefit from this vaccine. Now, there are 3 types of vaccines: the quadrivalent or the 4-type vaccine, also called Gardasil, that is the brand name now available. Now, this protects against 4 serotypes of the virus. Then we have the nonavalent or Gardasil 9, which will protect against 9 virus strains. They say it is equally effective. If we are getting protected against 16 and 18, it is good enough. But yes, these all strains are the strains which are associated with cancer cervix. So 9 virus strain is definitely a slightly more effective vaccine than the quadrivalent. And then we have the best part of it is that now we have the first indigenously produced vaccine in India, and that is rolling out in April of 2023, the Servavac, which is produced jointly by Serum Institute and the Biotechnology Institute of India. Now, this is the first Indian vaccine, and the best thing is the price is only 200 to 400 rupees. per dose, whereas the nonavalent Gardasil 9 is 9,000 rupees per dose, and the quadrivalent is around 3,000 to 4,000 rupees per dose. So this dose is really cheap, and now we can put it in the national immunization program also, which is what is the government proposing, that in the coming years, maybe by next year, now this will become just like a DPT or a tetanus toxoid or a tetanus diphtheria vaccine, that every girl should be given this vaccine. So the 4 and 9 strain vaccines protect against 7 diseases, that is cervical cancer and precancer, genital warts, vulvar cancer and precancer, and vaginal cancer and precancer. Age group is 9 to 45 years, can be given in lactating women also, but not yet approved in the pregnant woman. Now, for any dose, please remember that in case it is given to a woman or a girl who is less than 15 years, then only 2 doses are essential. But if it is taken after 15 years of age, then 3 doses have to be given. And after 30 years of age, screening should be as usual for cancer cervix. So what is the dose schedule? Now, supposing I take this vaccine, then after 2 months, I should take the next dose, and 6 months from today, I should take the 3rd dose. Now, how soon will the protection work? It seems that the protection, there is full protection, comes within a month of the last dose. So by 7 months, we will be completely protected against the cancer cervix. How long will the protection last? This lasts a lifetime, and there have been no reports as yet of a vaccinated woman who was HPV free before vaccination who develops a cancer. Yes, it could have been an undetected HPV infection, which might give a cancer later on, but no, as yet no reports. What about the side effects? The vaccine have been studied and is safe and well tolerated. Mild side effects like pain, redness could be there just like any injection. So what next? So next is get screened. Even if the cancer has started, it can be detected at an earlier stage. And this is the way out for the people who have not yet, like for my age group. Now, I have not taken this vaccine. This vaccine was not there when I was 9 or I was 15. It came a long time after that. So now the next step is just get yourself screened regularly and we are safe. Now, what is the screening? The screening is the pap smear. When you come to a doctor and you tell her, I want to get screened or I want this test for cancer, we will say, okay, we will do a pap smear. That is the simplest thing. And then, of course, there are other screening methods, but this is the basic. Now, this is a simple, quick, painless procedure. It takes just about 5 minutes. It is done in the OPD and there is no anesthesia needed for this. It should be done every 3 years, starting either 3 years after the onset of sexual relationship, that is the ideal age, or 30 years of age till the age of 65 is when it can be started in case we are resource limited. For example, a country like India, we say that 30 years of age is good enough for the screening to start, and it should be done within 10 days of the end of your periods. During periods, we cannot do the screening test. Now, the summary to sum it all up is that cervical cancer is the second most common cancer affecting the Indian women. It is a fully preventable disease. We can protect ourselves, we can protect our daughters, sisters, wife, friends, and be almost 100% safe with a combination of vaccination and screening. With that, I end my talk. Thank you so much.
Thank you, madam. ಹೆಣ್ಣು ಮಕ್ಕಳಲ್ಲಿ ಬರುವಂತ ಒಂದು ಕ್ಯಾನ್ಸರ್, ಅದು ಕೂಡ ವ್ಯಾಕ್ಸಿನ್ ಮೂಲಕ ತಡೆಗಟ್ಟಬಹುದಾದಂತ ಒಂದು ಏಕಮೇವ ಕ್ಯಾನ್ಸರ್ ಅನ್ನೋದು ನಮ್ಗೆ ಒಂದು ಸಮಾಧಾನದ ವಿಷಯ. ಮತ್ತೆ ಭಾರತ ಸರ್ಕಾರ ಭಾರತದಲ್ಲಿ ಹೊಸ ವ್ಯಾಕ್ಸಿನ್ ಪ್ರೊಡಕ್ಷನ್ ಆಗಿದೆ. ಅದು ಎಲ್ಲರಿಗೂ ಕೂಡ ಸಿಕ್ಕುವಂತ ಒಂದು ಒಳ್ಳೆಯ ವಿಷಯ ಈ ವರ್ಷ ಘಟಿಸ್ಲಿಕ್ಕೆ ಇದೆ. ಅದು ನಮ್ಗೆಲ್ಲ ಅದನ್ನ ನಾವು ಸ್ವಾಗತಿಸ್ತೇವೆ. ಆ ವ್ಯಾಕ್ಸಿನ್ ಬರುವುದನ್ನ ಎಲ್ಲಾ ಮಕ್ಕಳು ತೆಗೆದುಕೊಳ್ಳುವಾಗ್ಲಿ ಎಲ್ಲರಿಗೂ ಸಿಗುವಾಗ್ಲಿ ಅಂತ ಆಶಿಸ್ತಾ ಮುಂದಿನ ಸ್ಪೀಕರ್ ಅವ್ರನ್ನ ನಾನು ಇನ್ವೈಟ್ ಮಾಡ್ತಾ ಇದ್ದೇನೆ. ಡಾಕ್ಟರ್ ಪದ್ಮ ಪ್ರಕಾಶ್, ಮಕ್ಕಳ ಹಾಗೂ ನವಜಾತ ಶಿಶುಗಳ ತಜ್ಞರು. ಇವರು MBBS ಮಾಡಿದ್ದು ಬಳ್ಳಾರಿ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ನಲ್ಲಿ, ಆಮೇಲೆ ಪೋಸ್ಟ್ ಗ್ರಾಜುಯೇಷನ್ ಮಾಡಿದ್ದು JJMC ಯಲ್ಲಿ. ರೆಡ್ ಕ್ರಾಸ್ ಸೊಸೈಟಿಯ ಸಹಯೋಗದಲ್ಲಿ 2005ನೇ ಇಸ್ವಿಯಲ್ಲಿ ಶ್ರೀಲಂಕಾ, ಅಂಡಮಾನ್ ನಿಕೋಬಾರ್ ನಲ್ಲಿ ಸುನಾಮಿಯ ಸಂತ್ರಸ್ತರನ್ನ ಚಿಕಿತ್ಸೆ ಮಾಡಲು 1 ವಾರಗಳ ಕಾಲ ಮಾಡಿ ತಮ್ಮ ಸೇವೆಯನ್ನ ಸಲ್ಲಿಸಿರ್ತಾರೆ. COVID-19ರಲ್ಲಿ ಕರ್ನಾಟಕ ಸರ್ಕಾರದ ಟಾಸ್ಕ್ ಕಮಿಟಿಯಲ್ಲಿ ಸದಸ್ಯರಾಗಿದ್ರು. 1000ಕ್ಕೂ ಹೆಚ್ಚು ಕೋವಿಡ್ ಸಂತ್ರಸ್ತರಿಗೆ ಟೆಲಿಕನ್ಸಲ್ಟೆಂಟ್ ನ ಮೂಲಕ ಅವರಿಗೆ ಮಾತುಗಳ ಮೂಲಕ ಅವರನ್ನ ಚಿಕಿತ್ಸೆಯನ್ನ ನೀಡಿದ್ದಾರೆ, ಅವರಿಗೆ ಸಮಾಧಾನವನ್ನ ಕೊಟ್ಟಿದ್ದಾರೆ. ಅನೇಕ ಶಾಲಾ ಕಾಲೇಜುಗಳಲ್ಲಿ, ವಿದ್ಯಾಲಯಗಳಲ್ಲಿ, ಮಹಿಳಾ ಸಂಘಗಳಲ್ಲಿ ಆರೋಗ್ಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟ ಉಪನ್ಯಾಸಗಳನ್ನ ನೀಡಿದ್ದಾರೆ. ದೂರದರ್ಶನದಲ್ಲಿಯೂ ಕೂಡ ಆರೋಗ್ಯ ಸಂಬಂಧಿತ ಉಪನ್ಯಾಸಗಳನ್ನ ಕೊಟ್ಟಿದ್ದಾರೆ. ಪ್ರಸ್ತುತ ಮಕ್ಕಳ ತಜ್ಞೆಯಾಗಿ ವಿ ಕೇರ್ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್ ದೊಡ್ಡಬಳ್ಳಾಪುರ ಹಾಗೂ ಆಸ್ಟರ್ ಕ್ಲಿನಿಕ್ ಯಲಹಂಕದಲ್ಲಿ ಸೇವೆ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದಾರೆ. ಇವರು ಇವಾಗ ವುಮನ್ ಹೆಲ್ತ್ ಅಂಡ್ ಸೊಸೈಟಿ, ಮಹಿಳೆಯ ಆರೋಗ್ಯ ಮತ್ತು ಸಮಾಜ, ಇದರ ಬಗ್ಗೆ ಮಾತಾಡ್ಲಿಕ್ಕಿದ್ದಾರೆ. ಅವ್ರನ್ನ ಎಲ್ಲರ ಪರವಾಗಿ ಪ್ರೀತಿಯಿಂದ ಸ್ವಾಗತಿಸ್ತಾ ಇದ್ದೇನೆ ಮೇಡಮ್. ಸ್ವಾಗತ.
ಥ್ಯಾಂಕ್ ಯು. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. On behalf of MAKSB, my heartfelt thanks to Dr. Lakkol sir, Secretary Dr. Karnakara sir, and our chairman Dr. Arvind and Dr. Suresh Kagalkar as well. And thank you, Dr. Veena madam, and all the participants who are here. Thank you so much for giving me this opportunity. And once again, happy Women's Day to all the wonderful women who are present here. Is it visible now?
No, you have come to the last slide, ma'am. Come to the first slide.
ma'am.
Just use the arrow mark. The first.
Yeah.
Now you can
Full
go.
screen now?
Full screen ಆಗಿಲ್ಲ madam. Full
ಆಗಿದೆಯಾ?
screen ಆಗಿಲ್ಲ.
ಆಗಿಲ್ವಾ?
ಹ್ಮ್.
ಈಗ?
ಹಾ, ಈಗಾಯ್ತು.
Okay. So women's health and society. So ಸ್ವಲ್ಪ ಡಿಫ್ರೆಂಟ್ ಟಾಪಿಕ್ ಅನಿಸ್ಬೋದು. ಯಾಕೆ ಅಂತಂದ್ರೆ ನಾವು ವಿ ಟಾಕ್ ಅಬೌಟ್ ವಿಮೆನ್ಸ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಡೇ ದಿನ ವಿ ಟಾಕ್ ಅಬೌಟ್ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ ಅಂಡ್ ಅಡ್ವೊಕೇಟ್ ದೀಪಾ ಅವರು ಬಂದಿದ್ದಾರೆ. ವಿ ಟಾಕ್ ಅಬೌಟ್ ಲೀಗಲ್ ಇಶ್ಯೂಸ್. ಸೊ ಬಟ್ ಸ್ಟಿಲ್ ಐ ಥಾಟ್ ಹೌ ದ ಪರ್ಸ್ಪೆಕ್ಟಿವ್ ಆಫ್ ವಿಮೆನ್ಸ್ ಹೆಲ್ತ್ impacts on society ಅನ್ಕೊಂಡೆ, ಬಟ್ ಲೇಟರ್ ಐ ಜಸ್ಟ್ ಚೇಂಜ್ ಮೈ ಸೆಲ್ಫ್. So many people, they think that why this women health is so much prioritized and how does it impact on the society? So why it is so? Women is a silent pillar of the whole family's health. So I hope all of you agree with this, because healthier women and their children definitely will contribute to the productive as well as the educated communities. Example, when a woman in the family faces severe illness or a death, so there will be definitely, I think you must have come across in and around your families or in the society. So you must have seen the family suffering. Like, there can be decline in the health of the child or the education of the child, even the economic outcome, because there are many women who are facing the dual, problem, like they're coping up with both the household activities as well as their careers. And especially these problems are seen in the nuclear families, because we are approaching, when we compare 1930s, when we are in 2023, so a lot of nuclear families have come across. So this is how, when whatever happens, the health issues of a women, so that will have a lot of impacts on the families as well. So on the International Women's Day, once again, I would like to say, what was the theme? What is the theme? So it is Digit All. So because as we are approaching in the 21st century, we are giving more importance to the innovation and technology for the gender equality. This is our theme. So here, why I want to take up this? Because exploring the impact of the digital gender gap and broadening social and economic inequalities. Because whatever we see earlier, even though we say it is a mobile and the television addiction, but still without mobile or without social media, nowadays it's becoming, because it's easy to get the knowledge, information as well. So that is the reason that Digit All. So this is to improve the innovation and technology for gender equality. So just getting back, I think most of you are aware that how this International Women's Day got celebrated. So it was observed in the United States on February 28, 1909, in commemoration of 1908 garment workers. So it basically started with the labor, the women who were working to protest against their harsh working atmosphere where they were working in the place. So it started, the strike started in the New York. Later, after many years, in 1945, the United Nations Chapter 1, they had an agreement saying that, okay, let women also they work, whether it's a working atmosphere, the skill, the wages, how much ever they spend. So there should be not disparity between the men and the women for the wages. So in 1975, March 8th, the UN declared and observed as the first International Women's Day. So it's only 75, almost we are 43 to 48 years now that we are celebrating International Women's Day. Earlier, so many years, 1908 to 1975, women, they were so strong enough, they fought for their rights. So this is most important because just I thought that how is the sex ratio of men and women. So first, where you can see the oranges, that is where you can see that North America, a few parts of South America and the China and all. So more females than the male, the orange one. Where the green is more males than females, where we get in India as well. See here, even in spite of government having a lot of implementation of the laws, still the male are more compared to the female, but the ratio is coming down, of course, it is 48 to 50%. So similar proportion of males and females are seen in Australia. Here, I think Australia and some parts of South America as well. One more slide where I want to again just update like how the male-female ratio, Saudi Arabia, India, Pakistan, Malaysia, Afghanistan. This is a world gender ratio of male and female. So coming to India, it is almost 53,84,139 more men compared to the women. One more interesting slide I thought. Have to statistics of the women. So in the world, we are 3.8 billion women compared to 3.9 billion men in the world. Out of this 380 crore women, 65 we are in India. So out of 140 crore of population in India, 64% live in rural areas and 36% live in the urban area, out of which 48 women. Again, the proportion I want to update, 48% versus 52% are the men. Women of rural population play an important role in rural, like example, they are farmers, they are daily wage earners, educators. Now, after latest, we have a lot of startups where a few entrepreneurs are coming up. So earlier days, most of the time they used to have the household works. So because of this technology innovation and all, they're coming with even startups as well. So many women are custodians of traditional knowledge, and they play a major role for their community's livelihood and the continuation of the culture. Because when we say women and men, so they keep women to have the continuation of the traditional knowledge as well, which in spite having the dual work load, the women continue to have this traditional knowledge. Again, that will then make us a livelihood for themselves. As Dr. Kaur has updated us, what are the health issues in the women? So coming to the health issues in the medical terminology, the first and foremost is the breast cancer. The second is a cervical cancer, as Dr. Kaur was saying that by the time we finish this 1 hour talk, there will be 8 women will be getting suffered of cervical cancer. So we have to be very careful regarding that. Of course, all of you are aware, like pregnancy-related issues, menopausal issues, anxiety and depression of the latest because of lot of work pressures, dual, in the coming slides, I'm going to update how the dual work the women does, and hypertension, of course, diabetes mellitus, all these days, even younger generations are getting affected of hypertension and diabetes. It is not only male or the female, even the 30-35 years, they are suffering with this. So these are the major health problems what the women face. And looking back, like we have to look what are the causes for these health issues. My slides are hurrying up. So the causes of women health issues, it starts from the conception. See, malnutrition in the young girls or the poor maternal health will lead to the birth of malnourished babies. It's obvious. So any girls who are getting married less than 18 years. So we see in a lot of rural areas, especially during the COVID time. So many girls, they got married at a very early age. So when they have hemoglobin at 6 and 7, what we expect for the newborn babies having? Naturally, the malnourished babies. The young generation, both the rural, urban, low, middle or higher socioeconomic status, they're influenced by junk food. I think Veena madam, last time we had a diet talk, very interesting talk. It was from one of our doctor. So after it was very interesting actually. So, but because of heavy schedules, we are neglecting our eating habits. So especially as I told, whether it is a rural, urban, low, middle or higher class families, these generations are getting influenced by the junk food, of course, social media influencers, and lot of advertisement to keep them very slim. So we see a lot of advertisements keeping that you lose weight. Within 1 month, you lose 10 kgs. Within 15 days, you lose 10 kgs, which is not at all good for our healthy body, because our body is very unique. We are very unique anatomically and physiologically. So these are the causes that younger generation are getting influenced. And of course, binge eating, dieting, work stress, unhealthy competition at the workplace, very important. So here the colleagues again, whether it is male or a female, we have a lot of unhealthy competitions, whether any profession you take, because a lot of women come to me for counseling saying that, so these are practices are causing them mental stress in vicious cycle, their health is getting neglected. Of course, the genetic and environmental causes play a major role. Sorry. So genetic and environmental causes plays a major role in having diseases in the women. In turn, they decrease working capacity as well as the economic instability. So again, facts about women. Female workforce participation has increased in 5 decades. Totally, the rate has increased from 20% over 15 years, where women are economically they're active. The female to male doctors ratio, example, just because we are into the IMA case, where I took up the ratio, where in 1990, only 29% used to be women who used to join to as a doctor, which has increased gradually. Now it is 45% by 2015. So it's almost 45% women. Even soft skill women jobs are taken up. Health sector jobs have been taken up by the women. But when we represent the skilled, they're again low. The statistics shows that even though they take up the health sector, the skilled job-wise, they are very less. Globally, this is very much interesting, and we should be really proud that globally 12.4% of pilots are Indian women compared to other countries like Australia is only 7.5%, Canada 7%, USA 5.5%, and UK 4.7%. You can say that our population is 140 crores. So you said that women are 48% of that, could be that ratio is more. But still, we are very dare enough to take up the skilled jobs. So we should really feel proud that 12.4% of the women are pilots from India. According to even telecommunication ITU, the report says that 63% of the women compared to 69% of the women. So even in IT sectors, because they work round the clock, 24/7, they do work. So they are capable mentally as well as physically to handle such jobs which runs 24/7. Women working outside home is 64% now compared to 34% 1950s. So almost 73 years. So we have become double almost. So we are working so that it gives a economy of the India, like what we say, that is also getting increased. I don't know why this slides. So this is a picture I would like to just update how the women are doing dual work, whether it is in the urban areas or the rural areas. Even rural areas, women, they have to take care of their families, domestic work, they have to take care of the children. So they have to do a lot of work at the same time. So they're mentally strong enough. When we look back into our mother or wherever the grandmothers, I think they were more intelligent and smart enough to handle the situation, everything, because education is not everything. So it can be education just to read and write, but to handle the crisis is very important, especially during their in and out activities. So which is to get handled very well now as well as in the previous years. This is the urban woman handling so many things, because she has got 6 hands here. So having household work, their job, computers, then she's having household works as well, making the children study. So, but still she's taking care of herself also. So that is very much important. See, when they take care of, because of mental stress, so taking care of your work personally to look good or to have physically or mentally strong you have to be. So you have to spend some time for yourself, whether doing yoga or having a good hobby. So these are the things. Now Dr. Veena madam is only like, she's a living example for us. So much she is active. She is a ವೈದ್ಯ ಬರಹಗಾರರು. ಅವರು ಕೇಳಕ್ಕೆ ತುಂಬಾ ಖುಷಿ ಆಗುತ್ತೆ. ಮತ್ತೆ ಅವ್ರಿಗೆ ತುಂಬಾ ಆರ್ಟ್ ಎಲ್ಲ ತುಂಬಾ ಇಂಟ್ರೆಸ್ಟ್ ಇದೆ ಅವ್ರಿಗೆ. ಸೊ ಈ ತರ ನಮ್ ಮುಂದೆ ಲಿವಿಂಗ್ ಎಕ್ಸಾಂಪಲ್ಸ್ ಇರ್ಬೇಕಾದ್ರೆ, ಸೊ ರೋಲ್ ಮಾಡೆಲ್ಸ್ ಇರ್ಬೇಕಾದ್ರೆ, even we should have to follow such people's activities as well. Slides are running. So how you handle these health issues? So first you should come within self. So whenever you have any issues, the women should be strong enough to handle this. So self importance means they should have self confidence. Again, it is from the health, help from the family members, supporting healthcare system, awareness through free health camps, NGOs, government programs, which is getting implemented through social media, campaigns and slogans. I'm sorry, extremely. The slides are just running. Can anyone handle this?
What happened, ma'am?
It's moving fast, my slides.
Self, it's moving.
No, I'm just pressing.
Just share it again once. Madam is disconnected, I think.
ಲೆಫ್ಟ್ ಆದ್ರ ಅಂತ.
Madam is disconnected.
She will join now.
Yeah.
Hello. Dr. Veena madam.
Yeah.
Hello. Yeah.
ಹೇಳಿ sir.
We'll go to the next speaker. Dr. Deepa madam will start. And meantime, once she finishes, let her continue the other.
ಹಾಗೇನಾ? I think she will join. ಅದು ಲಾಸ್ಟ್ 2-3 ಸ್ಲೈಡ್ ಇತ್ತು ಇಷ್ಟ ಇತ್ತು ಸರ್. ಅವ್ರದ್ದು.
ಅಲ್ಲ ಇರ್ಲಿ, now the viewers are will become upset. So Dr. Deepa madam will start. Before that, please go through the CV of the Deepa madam.
One second. Hello. ಇದೆ. ಲಾಗಿನ್ ಆಗ್ತಾ ಇದ್ದಾರೆ ಸರ್ ಅವರು. ಒಂದ್ ನಿಮಿಷ ಇದೆ. ದೀಪಾ ಮೇಡಮ್ ಪೈಲಟ್ಸ್ ಜಾಸ್ತಿ ಆಗಿದ್ದಾರೆ ಅಂತ ಹೇಳಿದಾಗ ನಾನು ಇತ್ತೀಚೆಗೆ ಒಬ್ರು ಹೇಳೋದ್ ಕೇಳಿದೆ, ಲೇಡೀಸ್ ಪೈಲಟ್ಸ್ ಇದ್ರೆ ಫ್ಲೈಟ್ ಚೆನ್ನಾಗಿ ಲ್ಯಾಂಡ್ ಆಗುತ್ತೆ, ಜರ್ಕ್ಗಳೇನು ಇರೋದಿಲ್ಲ ಅಂತ. ಮೀನ್ಸ್ ದೇ ಆರ್ ವೆಲ್ ಅಂತ. ಯಾಕಂದ್ರೆ ಕಾರ್ ಡ್ರೈವಿಂಗ್ ಗೆಲ್ಲ ನಮ್ಮ ಹೆಣ್ಮಕ್ಳಿಗೆ ಒಂಥರ ಮುಖ ಮಾಡ್ತಾರೆ. But lady pilots are doing well, it seems.
Yeah, yes, ma'am, because they concentrate a lot. So that is what, that patient is there in ladies a lot. Each and every moment in family, other outside also, everything, they have a lot of patience. For that only, they can drive it and be a good pilot.
Yeah, Padma madam
I'm
is back.
extremely sorry.
Yeah, madam. You share your screen.
I think only few slides are left. Just 2 minutes and finish.
Yes.
So what are the solutions for these problems what we have? India needs to break vicious cycle of malnutrition and poor education to escape poverty among the women. India is very diverse and would need specific solutions for women betterment. Changing the mindset of people is very important. So in rural areas, especially, I don't want to mention the states, northern states still have this harassment. They think women, okay, it's okay, no need to get take her to the hospital until it is an emergency. Especially deliveries have been still conducted at home. I've seen northern Bihar, Rajasthan and all. So they do conduct deliveries at home in spite of getting we are so much scientifically very improved. So changing the mindset of women, whether it's a men or the women and the society as well, and skilling and giving opportunity to the women workers, zero tolerance for sexual harassment, workplace mental harassment. I think Deepa madam will update more about this. So workplace mental harassment and strict implementation of laws. So I just quoted that healthy women, healthy family, then healthy society. The most alluring thing is that women can have self-confidence, which matters the most important, whichever sector they are, this is the most important. She has become strong enough for social change in India. To promote economic prosperity and equity by women health, leaders must take strong decision and implement the laws appropriately. We need resources, dedicated manpower, and of course, a women professional across all levels in all fields. So it is a combined effort of the family, the mindset of the women, as well as the society. So it is a society's responsibility even at the micro levels, so that we can make a healthy women, a healthy family, and a healthy society. So ಹೆಣ್ಣಂದು ಕಲಿತರೆ ಶಾಲೆಯಿಂದ ತೆರೆದಂತೆ. Just I want to conclude my slide with this, because if ಒಂದು ಹೆಣ್ಣು ಕಲಿತರೆ, so on the shale teradage, many people will get educated. When women get education, of course, health awareness follows. That is what I believe in. So the modern women has started caring for themselves, whether it is social, emotional, cultural, religious, as well as economic needs. So this is a diagram I want to say. So we should encourage the girl children to go to school, of course, so that in turn they become a healthy future generation, which can lead all of us in a better way. Thank you so much for giving me this opportunity. And sorry, I missed, my slides were running. So once again, thank you so much. Thank you.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ನೀವ್ ಹೇಳಿದಾಗೆ ಅರೌಂಡ್ 64% ರೂರಲ್ ಏರಿಯಾದಲ್ಲಿ ಇದ್ದಾರೆ ಹೆಣ್ಮಕ್ಳು. ನಾವ್ ಹೆಣ್ಮಕ್ಳ ಸಮಸ್ಯೆ ಅಂದಾಗ ನಮ್ಗೆ ಕಾಣೋದು ನಮ್ ಮುಂದೆ ಇರೋ ಆಫೀಸಿಗೆ ಹೋಗೋ ಚಂದ ಡ್ರೆಸ್ ಹಾಕೊಂಡು IT BT ಕೆಲಸ ಮಾಡೋರು. ಆದ್ರೆ ನಾವು ಈ 44% ಜನ ರೂರಲ್ ಏರಿಯಾದಲ್ಲಿ ಇರೋರ್ನ ನಾವೆಲ್ಲೋ ಮರಿತೀವಿ ಅಂತ ಅನ್ಸುತ್ತೆ. ಕಷ್ಟದಲ್ಲಿ ನೀವು ಇವಾಗ ಉತ್ತರ ಭಾರತದಲ್ಲಿರುವಂತ ಕೆಲವು ರಾಜ್ಯಗಳಲ್ಲಿ ಇರ್ಬೋದು, ಆ ತರದ ಹೆಣ್ಮಕ್ಳು ನಮ್ಮ ಊರ್ನಲ್ಲೂ ಸೌತ್ ಕೇಂದ್ರ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗಿದೆ ಅಂತಂದ್ರು ನಾವು ಎಷ್ಟೋ ಜನರನ್ನ ನೋಡ್ತಾ ಇರ್ತೀವಿ. ಅದೊಂದು. ಇನ್ನೊಂದು, ಹೆಣ್ಣೊಂದು ಕಲಿತರೆ ಶಾಲೆಯೊಂದು ತೆರೆದಂತೆ ಅನ್ನೋ ಮಾತಿಗೆ ಸಾವಿತ್ರಿ ಪುಳೆ ಅವರ ಉದಾಹರಣೆ. ತಾನ್ ಕಲ್ತ ಮೇಲೆ ತಾನೇ ಒಂದು ಶಾಲೆ ಪ್ರಾರಂಭ ಮಾಡಿ, ಎಷ್ಟು ವಿರೋಧ ಇದ್ರೂ ಕೂಡ ಅದನ್ನೆಲ್ಲ ಸಹಿಸಿ ಶಾಲೆಗಳನ್ನ, ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೋಸ್ಕರ ಶಾಲೆಗಳನ್ನ ಪ್ರಾರಂಭ ಮಾಡಿದವರು. ಸೊ ಅವ್ರನ್ನೆಲ್ಲ ನಾವು ನೆನಪಿಸ್ಕೊಳ್ತಾ, ಸಮಾಜದಲ್ಲಿ ಹೆಣ್ಣು ಗೆ ಒಂದು ಶಕ್ತಿ ಬಂತು ಅಂತಾದ್ರೆ, ಒಂದು ಪವರ್ ಬಂತು ಅಂತಾದ್ರೆ ಇಡೀ ಮನೆ, ಒಂದು ಊರು, ಒಂದ್ ದೇಶನೇ ಉದ್ಧಾರ ಆಗುತ್ತೆ ಅನ್ನೋ ನಿಮ್ಮ ಮಾತಲ್ಲಿ ಮೂಡಿ ಬಂತು. ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾತಾಡಿದ್ರೆ. ಎಲ್ಲರ ಪರವಾಗಿ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳ್ತಾ, ಇನ್ನು ಮುಂದಿನ ಭಾಗ ಹೆಣ್ಣಿಗೆ ಸಿಕ್ಕಿದಂತ ಏನು ರೈಟ್ಸ್, ಕಾನೂನುಗಳು, ಹಕ್ಕುಗಳು, ಭಾರತದಲ್ಲಿ ಏನ್ ಹಕ್ಕುಗಳು ಹೆಣ್ಮಗುವಿಗೆ ಕೊಟ್ಟಿದ್ದಾರೆ ಅನ್ನೋದನ್ನ ನಮ್ಗೆ ತಿಳಿಸಿ ಹೇಳಲಿಕ್ಕಿದ್ದಾರೆ ದೀಪಾ ಇವರು. ಹೈಕೋರ್ಟ್ ವಕೀಲರಾಗಿದ್ದಾರೆ. 8 ವರ್ಷಗಳಿಂದ ತಮ್ಮನ್ನ ವೃತ್ತಿಯಲ್ಲಿ ಸಂಪೂರ್ಣವಾಗಿ ತೊಡಗಿಸ್ಕೊಂಡಿದ್ದಾರೆ. 24 ಗಂಟೆ ತೊಡಗಿಸ್ಕೊಂಡಂಗೆ ಕಾಣಿಸ್ತಾ ಇದೆ. ಅವರು ಕಾನೂನು ಸಲಹೆಗಾರರಾಗಿ ನಿನ್ನೆನೆ ಅವ್ರು ಹೇಳಿದಾಗೆ ಕರ್ನಾಟಕ ಪ್ರಾದೇಶಿಕ ಕುಮಾರರ ಸಂಘಕ್ಕೆ ನಿನ್ನೆ ಆಯ್ಕೆ ಆಗಿದ್ದಾರೆ ಅಂತ ಹೇಳಿದ್ರು. ಎಲ್ಲರ ಪರವಾಗಿ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳ್ತೇನೆ. ಅಷ್ಟೇ ಅಲ್ಲದೆ ಅವರು ಕನಕ ಸೇವಾ ಸಂಘಕ್ಕೆ ಹಾಗೂ ಬ್ಯಾಂಕ್ಗಳಲ್ಲಿ ಪ್ಯಾನೆಲ್ ವಕೀಲರಾಗಿ ಕೂಡ ತಮ್ಮ ಸೇವೆಯನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದಾರೆ. ಈಗ ಎಲ್ಲರ ಪರವಾಗಿ ನಿಮ್ಗೆ ಸ್ವಾಗತವನ್ನು ಹೇಳ್ತಾ, ಭಾರತದ ಮಹಿಳೆಯ ಹಕ್ಕುಗಳು ಅನ್ನೋ ವಿಷಯದಲ್ಲಿ ನಮ್ಮೆಲ್ಲರನ್ನ ಉದ್ದೇಶಿಸಿ ಮಾತಾಡ್ಬೇಕು ಅಂತ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೇನೆ. ಸ್ವಾಗತ ಮೇಡಮ್.
ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ವೆಲ್ಕಮಿಂಗ್ ಮೀ. ಇದರಲ್ಲಿ ಈ ಸೆಷನ್ ಅಲ್ಲಿ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡೋದಕ್ಕೆ ಬಹಳ ಹೆಮ್ಮೆ ಪಡ್ತೀನಿ. ಐ ಆಮ್ ಸೋ ಪ್ರೌಡ್ ಆಫ್ ಟು ಬಿ ಹಿಯರ್. Actually, basically, I was a teacher. So, and before that, I was a sports champion and everything. So, being a lady, for achieving each and every stage, it is it's so we have to work hard and everything. It's not so easy. So each and every level. When I was in school days, I was sports champion, athletics champion, and everything. So I was never as an audience. So I was always on the stage and everything. And later, after teachers training, I got distinctions, and I did MBA and MA, and even diplomas and painting also I got distinction and everything. So after that, when I entered into the family, I started studying and I became a lawyer and everything. And as Veena Madam said, 24/7, I have involved in this. Thank you for impressing me. Thanks a lot. So here, one thing I want to tell for everybody who in whole world, Happy Women's Day first. So in our India as well as in our Karnataka, we are very much proud to be here. And I was born and brought up in Bangalore itself. So here we learn so many languages and everything. So here as a Padma Prakash Madam and as well as Manpreet Kaura Ma'am. So explained about cervic cancer, and Padma Prakash Ma'am said about the society. So it is much linked about my subject actually. What she spoke about that and everything, it is linked. And for the organizers who have arranged Shivkumar Sir, Karunakar Sir, Arvind Karunakanwar Sir, Suresh Kalwas, thanks a lot for arranging such a good session, so that we'll have a good knowledge about all this circulation, everything. Here and Happy Women's Day once again for all. So I'll start with the session. And so here I just want to give an introduction. So earlier stage, when in a British time and all, women were not coming outside. So they were at the home, and little slowly, and Sati system, Rajaram Mohan Roy, and he just made women a very important thing, and everything slowly, slightly got changed. And it's a cumulative actually, slowly developing. We have to come out. many women still 50 to 60% they have come out and they are doing good, everything. But still so many things they are facing that is not known to everybody. So as Padma Prakash ma'am said, as a nuclear family, so earlier it was a joint family. I just want to touch that topic. When there was a joint family, they used to share the work between the ladies, and they used to have understanding between them, and everything was going good, and they could do something. But the thing is that they didn't come out. But when at present everybody are trying to come out and they are achieving, but some lacking behind, that supportiveness is lacking behind. So because of that, and when there is a nuclear family, some legal issues arises there. So based on that, even rights, women rights, we have to fight, and we have to get to that and everything. So with everybody's support, we have to come up. So I'll start with the slides. First thing, we'll come to know about the constitutional rights and women. The state shall not discriminate against any citizen of India on the ground of sex. So based on Article 15, subclause 1. So here, they should not discriminate either men or women. So yeah, they should be equal. So nowadays they are treating equally. So we should be proud. We have developed and we have improved. The state is empowered to make any special provision for women, Article 15, subclause 3. No citizen shall be discriminated against or be ineligible for any employment under the state on the ground of sex. So each and everybody nowadays, they are getting whomever, either it's not comparing. So nowadays it's good. So traffic in human beings and forced labor are prohibited. So in this topic also, Padma Prakash ma'am said about that. So while working in some places, harassment and everything is there. I'll explain again in detail a little bit later. Next, the state to secure for men and women equally the right to an adequate means livelihood. The state to secure equal pay for equal work for both Indian men and women in that. So equal pay, that means for men and women, there should not be any discrimination between men and women. So they should have a equal pay. Some in private places, even today it's there, but in government jobs and some places it's not there. Now it is okay. Now we'll come to know about the legal rights to women. So here, when we come to know, Protection of Women from Domestic Violence Act is a legislation protecting women in India from all forms of domestic violence of any kind, physical, sexual, mental, and emotional, and everything. So this is the thing, it is happening here in family issues, domestic violence cases, it is becoming more. And nowadays, because of this, even divorce cases also increasing. And in Bangalore, it is 8 court halls are there. But even that is not enough. And another 13 more court halls, it has been going to be extended. So it is happening because of DV Act cases. So this is what is happening today's life. And next one is Immoral Traffic Act is legislation for the prevention of trafficking for commercial sexual exploitation for the purpose of prostitution. So when the persons, they are going for working, even there also some problem issues arises for especially women's. Then Indecent Representation of Women Act prohibits indecent representation of women through advertisements, publications, writings, paintings, figures, or any other manner. Even these things should not be done for the women's. So that is the main here we have. So Commission of Sati provides for the more effective prevention of Commission of Sati and its glorification on women. Even Sati system, already I said that it has been removed. Dowry Prohibition Act 1961 prohibits the giving or taking dowry at or before or any time after the marriage from women. You know, within 7 years, if there is any harassment or dowry or anything it happens, so they are fighting a lot nowadays. It is happening. Then Indian Penal Code also contains provisions to protect women from dowry death, like 304B, rape section 375, 376, kidnapping section 359 to 374, cruelty section 498A, and other offenses. So nowadays it is increasing, and still it is not getting under control. It has to be done, and still they have to take care, and still strong amendment to be done and to protect women's. Then next we'll go. Maternity Benefit Act governs women's employment in certain establishments for certain periods before and after childbirth, and provides for maternity benefit and certain other benefits. These things who are in government jobs and they are getting a maternity, but in private working place, not much. They are not providing any salaries like that, so they are lacking behind with that. Then Medical Termination of Pregnancy Act 1971 provides for the termination of certain pregnancies by registering medical practitioners on humanitarian and medical grounds. So this point touches you all the doctors, because when some persons come for abortions and all, so you have to go with the particular rules and regulation with, according to law. So based on that, if there is any rape case, for the prevention or some doing good things for the women, so there is a termination of pregnancy. So based on that thing, doctors have to take care of the women's. Then next one, preconception and prenatal diagnosis techniques. Preconception and prenatal diagnosis techniques then prohibits sex selection before or after conception, and prevents the misuse of prenatal diagnosis techniques for sex determination. So here, even nowadays it has been become a strict rules in doctors. So nowadays they are not putting out either it is a male child or a female child. So now it is going on. Then the next one, Equal Remuneration Act provides for payment of equal remuneration to both men and women workers for same work or work of a similar nature. So it also prevents discrimination on the ground of sex against women in the recruitment and service condition. So equal remuneration, now it is giving, now it's good. So because of this rules and regulation, women are, they are encouraged and they are giving equal remuneration. Then next one, Dissolution of Muslim Marriage Act grants a Muslim wife the right to seek the dissolution of her marriage. Before, when we see in Muslim law, they used to, whatever they say, they have to be at home, and they can't take any personal decision in Muslim law. Nowadays, even they got so many rights, and they got in property share also 25% and everything. They have amendment has been taken place in Muslim law. And now when we take into Hindu Marriage Act introduced monogamy and allowed divorce on certain specified grounds. It provided equal rights to Indian man and women in respect of marriage and divorce. Here only monogamy, no polygamy, it is allowed. Only monogamy in sense only one wife. More than one wife, it is not allowed. If next here, if he wants to get married, he has to get divorced. So that is the thing. In our Hindu marriage as well as Christian or other religions. Then Hindu Succession Act recognizes the right of women to inherit parental property equal with men. So here when we see, according to Supreme Court recent 2018 last Supreme Court cases, it has come that so when the child by birth, she gets her rights in ancestral property. So now it has become a huge cases in our civil courts. So based on that, even grandma also applying cases if there is no transaction. So that is what it is going on nowadays. So we are filing so many cases, it's going on. So parental instance, if it is self-acquired property by father or mother, if he dies without writing or gifting or anyone, it is as it is. So then the children gets equal share, either male or female. So that is the thing, everything it has been amended. Then next we'll go for Minimum Wages Act does not allow discrimination between male and female workers or different wages for them. So these are the things there. Then very landmark cases. So Vineet Sharma cases, these are landmarks. It is a refer for us. The thing is that for just to know, I have only a few important cases. Shaira Banu cases, case and the Secretary, Ministry of Defense versus Babita Punya, then Mekhania, these are the very important landmark cases. Then next, the thing is that basic rights for women. I just want to tell you what I explained, just a main basic rights of women. Right to maintenance, right to equal pay, right to dignity and decency, right against domestic violence, right against workplace discrimination and sexual harassment, right against dowry, right to maternity leave, right against arrest. So these are the things nowadays we get a right. So we have to fight for our rights, each and everything. So that is the thing wanted to be told in a simple way. I have explained you everybody. So we should not misuse all these rights. We have to take what we have right and what the law and order it has been given for our safeguard, for women rights, everything it has been given. We have to utilize that and come forward, and everybody come, let's work in everything. Let us come up, and even in our political or whatever it is, 50% it has been given a placement for women's nowadays. So let us come out, let us join and do everything. Thank you for giving a chance for explaining for this. Thank you.
Madam.
Madam, you are not audible.
We didn't hear, ma'am.
Veena, mute to you. Veena ma'am, over to you.
Ma'am, some problem with her audio.
Unmute ಮಾಡ್ಕೊಳ್ಳಿ.
It's not unmuted.
It is unmute, ma'am. It is unmute.
It's an unmute.
Ma'am, disconnect and connect, ma'am. Once.
Yeah, Deepa, madam. I have got one question.
Yes, sir.
Hello.
Yes.
Yeah. This regarding the maternity benefit. What is the exact rule for the paternity benefit for the working men?
So maternity benefit, they are getting a few weeks earlier before giving birth to a child. They'll have some period of getting a leave. Then after giving birth also they are getting a time for that.
So how many months, ma'am? Is it 6 months now post delivery?
Yes, ma'am. They can extend that.
But minimum it is 6 months.
Actually, in our law, yeah, minimum 6 months is there. It's there. In weeks, they are telling in the weeks, 4 weeks, 6 weeks like that. But it can be extended. It can be extended to 1 year.
Up to 1 year, I think it is extended.
Extended.
1
yes.
year.
Yeah.
Yeah.
It can be. Some what are the reasons it has to be given? It can be extended. Minimum 6 weeks.
Madam, one more question. I am a urologist. Usually the patients comes for the sexual that is they're asking many letters. Usually the couples comes, the wife comes after the at the end of the husband who goes, then ask why you are giving such a drugs continuously and you are treating for the for increasing the sex. Is there any domestic violence for the against the husband? For
Sir, you are talking about adultery, I think so. More
not
than
adultery.
Polygamy, you are talking monogamy than polygamy. You are talking, I think so.
It is not a polygamy, madam. What I am asking, the wife and husband who comes to the clinic asking for the increase in the sexual act, they want more and more drugs. The husband asks, but wife afterwards she comes and requests, why you are giving? and now it's 50 years and you are giving so many drugs. And is there any act for just I want to, because it is her right to ask to the doctor.
Yes, because nowadays even such cases has come, because without her consent you cannot. So that is the thing. It has come a new law. You have to have a consent, and you should get a permission. That's what I can say. Correct, Vinaba?
Yeah, it's a mutual, it goes for counseling for both of
Yeah,
them.
that's what. So that thing issues come to you doctors only. We give advice after the case comes. That is the thing happens here.
Yeah, thank you, madam. Very informative, and we got so many laws for
there are so
protecting women. We came to know.
Each and every case is differs, sir.
Yeah. Any questions, madam? Yeah,
As
chat box.
you said, madam, whatever the laws are there, ಆ ಲಾಗಳು ಎಷ್ಟು ಉಪಕಾರಕ್ಕೆ ಬಂದಿದ್ಯೋ ಅದನ್ನ ಮಿಸ್ಯೂಸ್ ಮಾಡ್ಕೊಂಡಿದ್ದನ್ನು ಕೂಡ ನಾವು ನೋಡ್ತೀವಿ. ಅದಾಗದ ಹಾಗೆ ಕೂಡ ನಾವು ನೋಡ್ಕೊಳ್ಬೇಕಾಗಿದ್ದು ತುಂಬಾ ಮುಖ್ಯ ಆಗುತ್ತೆ. ಒಂದು. ಎರಡನೇದು, ಭಾರತದಲ್ಲಿ 6 ತಿಂಗಳು ಮೆಟರ್ನಿಟಿ ಲೀವ್ ಅಂತ ಹೇಳಿದ್ರು ಕೂಡ ಎಷ್ಟೋ ಸಂಘ ಸಂಸ್ಥೆಗಳು, ಎಷ್ಟೋ ಪ್ರೈವೇಟ್ ಕೊಡ್ತಾ ಇಲ್ಲ. ಜಪಾನ್ ನಲ್ಲೆಲ್ಲ 1 year ಅಂತೂ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಅದು ಒಂದು. ಮೂರನೇದು, ನಾನು ಏನ್ ಹೇಳ್ಬೇಕು ಇಷ್ಟಪಡ್ತೀನಿ ಅಂದ್ರೆ, ಪೋಸ್ಟ್ ಗ್ರಾಜುಯೇಷನ್ ಸೀಟ್ ತಗೊಂಡಾಗ ಕೆಲವು ಪ್ರೈವೇಟ್ ಕಾಲೇಜ್ಗಳಲ್ಲಿ ದೇ ಆರ್ ನಾಟ್ ಅಲೌಡ್ ದ ಗರ್ಲ್ ಲೈಕ್ ಲೇಡಿ PGs to become pregnant. They will tell, if you are becoming pregnant, you should not become pregnant. By chance pregnant ಆದ್ರೆ MTP ಮಾಡ್ಕೊಂತ ಫೋರ್ಸ್ ಮಾಡುವಂತದ್ದು ಕೂಡ ನಾವು ನೋಡ್ತಾ ಇದ್ದೀವಿ.
Yes, ma'am. I want touched with this pilot point. If they want to become a pilot, they should not become pregnant. Correct? If they become pregnant, they should resign the job. So that is the thing. How women can have, it's God's creation. That's the thing.
That's it. ಅದಕ್ಕೇನಾದ್ರೂ ಈಗ ರೂಲ್ಸ್ ತರಬೇಕಾಗಿದೆ ಮೇಡಮ್.
That we have to really, there's so many things. Still it is it's improving. We are doing so much. It has to be amended a lot for women's. Anyhow, we are now happier and we are coming out. That we should be proud.
I think more number of women representatives in the Lok Sabha, Rajya Sabha, whatever, ma'am, so that policy makers ಜಾಸ್ತಿ ladies ಆದ್ರೆ ladies ಗೆ we can do more help.
Yes, that's the thing. That's why I touched that political subject also, because they have to enter to that. Then only they will understand. Then only they can bring out what are the difficulties what we are facing. We are facing problems at home also. Everything we are taking care. So even in that Sabha also, we have to sit and talk. Actually, we have more power. Yes, so many things we have knowledge, but think that we cannot expose because we are sitting back. So we can discuss and we can explain. And even now, today also, amendment is very slow. When we come in Sabha section, we can amend a lot and bring so many changes in our India. Why it is not developed country, still it is developing country, because of these reasons only. We have to come out and do some changes for our country. That is what. So we have to put forth so many things for discussion. And in everything they'll be discussing about that we did this, everything. No, basic things, what we have to do for our country. We have to come out of with law and order only. So many amendments, what the British people they have left and went, that only we are still following. So many changes they have done amendment, but still it's not fast. It has to, because it's not our future generation and all, they have to enjoy. Let them be healthier, happier, mentally fit, everything. Let them come. If we do only, they can be. That's what.
Padma madam told, actually, in 1990, 29% of female doctors were there, and 2015, 45. I think in Kerala it is crossed 50%. As doctors.
Because male-female ratio is more in Kerala.
But the people entering politics, what is the ratio?
Very less.
I'll update in the next session, ma'am.
I want to ask one question to Manpreet Karur, ma'am. Actually, ma'am said we have to get for a test and all ladies and everything. So from child 9 years it starts, and we have to get a vaccination and everything. She explained so well. So it's a very important for the ladies. It's a very good topic what she has touched. And even Padma Prakash ma'am also touched about society. That is also very good topic for the women's only. It is actually, so everything is connected, and it is a very good topic. And Manaprit Kaur ma'am, I just want to ask, from next year it is going to might be start for the vaccination and everything like that. Actually for testing and all, whether any centers free testing like that, any from government side, everything will go ahead, or what will be the price for that? And because every person, every woman in India, they should be aware of this one, and let them come for test, because it's a very important, because they cannot come and discuss with others. Only with the doctors they can discuss. So what is the solution for this, and when it will go ahead, and let all women, so without cancer, let everybody be happy. So that is what my request, and something to be done. So can you explain for that, ma'am?
Ma'am, as you asked whether this is free, so in all government hospitals, wherever there is a gynecology department, this test is free of cost. And even in the medical college, private medical colleges also, because we want more and more women to get screened, it is just a ₹50 test. So it's a very cheap test and easily available, and lady doctors are there. I think women, number one, women need to be made aware of that there is such a problem, which can get detected if they go and meet the right person, number one. Number two, this test is easy and it is simple. It does not take a lot of money. It does not take any prolonged procedure. You just have to go talk to the doctor and the test gets done. And number three, they have to be aware that once this test is done, then they can, if the test comes negative, there is a solution. They can take a vaccine. If the test comes positive also, they don't have to get scared. There is a solution, and we treat, either it is in the pre-cancerous stage or it is in the post-cancerous stage. So the one thing you said is how can we help it? Now, I think gynecologists all over the country, we are really engaged in really marathon activities of trying to spread this awareness in all societies, all levels of the society. We are going to the slum areas, we are going to colleges, we are going to schools, both government as well as public schools, and we are going to women forums, inner wheel clubs and everything, to be able to get a little more awareness in women and get them to lose their inhibitions first. That is the most important thing, I think, because women do listen, and then women say, okay, no, I will go next time. Or, there is always something or the other reason for which a woman just puts it off because she feels shy. So we have to tell them that somehow, means whenever the patient comes to me, I tell her, every patient, I think every lady doctor is counseling any woman who comes to us for any other thing also, that now that you have come, please get a test. If she is a little reluctant, we say, okay, don't worry, make up your mind. Next time you should come ready with the test. We try to do this. This is called opportunistic screening. Anyone who comes, we just first counsel them and take them to screening. So these are the solutions which we are all working on. And I think by 2030, we hope to have 80%
Cancer-free India.
Cancer-free India, I think that is
cervical cancer.
2030 is, I think 80% of the women should be screened and 70% of the girls should be vaccinated by 2030. Cancer-free India is a little
cervical cancer.
very, very ambitious. Okay, cervical cancer. But still, I feel it's a very ambitious goal that we're having. But if we all agree, decide it is possible. But we need the Indian woman to feel a little shy of approaching doctors.
That's what I told ma'am. All the health issues, it should come from within self. They should feel that they have to go get checked. Second, of course, coordination, cooperation from the family members. Of course, government projects, what they have programs, NGOs, free health camps. Of course, in Karnataka, we're having a lot of free health checkups from the IMA KSB, each branch levels, especially women. So it is a collective decision as well as the improvement, if want any women's health improvement, so it has to come from all the sectors of the society. So even
ma'am.
women should come forward to utilize all the facilities. So which
Yes,
is very
because
important.
what we
I
are
think.
doing is now, initially we used to talk to only girls. Now we have started talking to the boys as well as the girls.
True.
Because the mother, the sister, the friend who should also be, immunized, and also the boys also come into the ambit, and we tell the boys also, because all foreign countries are recommending this vaccine for boys also, because of penile cancer, orogenital cancer. Then when we go to departments, for example, we go to the commissionerate or something, we initially used to go with the idea of talking to the women. Now we talk to men as well as the women, because it's a joint decision by the parents. They have children and they have younger sisters. Plus, when we go to schools, we not only sensitize the school children, because vaccination is not in their hand. We call the parents and we talk to the parents. So this is a talk that we make sure that it reaches the parents, because the parents will decide whether their daughter gets vaccinated or not. So I think we need to now go out from the girls' school or the girls' girls only talk, and we need to talk to men as well as women, as well as girls and boys, to make this awareness go out a little further.
And another one thing, ma'am, along with the cervic cancer test, breast cancer can be also be checked now, because that is also a very important thing, because for the women, breast cancer also it's becoming more nowadays.
Madam, we are screening. Yeah, when a woman comes to us, we screen at the same time for 3 things: one, cervix, then the breast, and oral cancer. So we just examine the cavity also. We are doing 3-in-1 checkups, but we need to get the woman to the examination table, and that is, I think,
that is the thing. That is what I wanted to ask. Yeah.
That is
Vinama, many questions from the audience?
And my students also are there. My
audience, any questions, ma'am?
Question is not there, madam. They are appreciated and they are happy about the program. And I wanted to IMA gather there, the IMA. Because we were talking about patients are coming and getting tested, all those things. But how many of doctors are getting tested? That is also important.
And even one thing, ma'am, my students also are there here in Align. I think so. Shabrishwari and all, she has done now. She has written MD exam. My students, many of them doctors have become, and they also have come. I think so. When they called me and spoke to me.
Yeah, there is no questions as such, madam.
Okay.
They are told like they appreciated the speakers. It was a very informative session. And thank you for Manpreet madam for the simple explanation and cervical cancer. And thank you for Padma Prakash madam. Like that appreciation is there, no questions as such. Okay. So what I was telling is I want from IMA Gadag, they have done pap smear for
one question.
Yes, sir. You are not audible, sir. Kelstilla.
Yeah. ನಮ್ ಜೊತೆಗೆ ಈಗ ಡಾಕ್ಟರ್ ಯೋಗಾನಂದ ರೆಡ್ಡಿ ಸರ್ ಇದ್ದಾರೆ. ಯೋಗಾನಂದ ರೆಡ್ಡಿ ಸರ್, ಯು ಆರ್ ಹಿಯರ್ ಸರ್.
ಹೇಳಿ, ಕೇಳ್ತಾ ಹೇಳಿ. ಕೇಳ್ತಾ ಇದೆಯಾ?
ಗುಡ್ ಈವ್ನಿಂಗ್ ಸರ್. ನಮಸ್ತೆ. ಗುಡ್ ಈವ್ನಿಂಗ್ ಡಾಕ್ಟರ್ ಯೋಗಾನಂದ ರೆಡ್ಡಿ ಸರ್.
ತುಂಬಾ ಕೇಳ್ತಾ ಇದೆ ಎಲ್ರದ್ದು. ನಮಸ್ತೆ ಮೇಡಮ್.
ಕೇಳಿಸಿದೆ ಸರ್, ಹೇಳಿ ಸರ್.
ಮಾತಾಡ್ತೀನಿ ಪ್ಲೀಸ್. ನನಗೆ ಪ್ರಶ್ನೆ ಇಲ್ಲ, ಆದ್ರೆ ಇವರು ಮೇಡಮ್ ಹೇಳಿದ್ರು ಪೈಲಟ್ಸ್ ನಮ್ಮವರೇ ಜಾಸ್ತಿ ಅಂತ. ನಾನು ಒಂದು ವಿಷಯ, ಭಾರತದ ಸಂಸ್ಕೃತಿಯಲ್ಲಿ ಅನಾದಿ ಕಾಲದಿಂದಲೂ ಹರಪ್ಪ ಮಾಂಜೋದರ ಸಿವಿಲೈಸೇಷನ್ ಕೂಡ ಹೆಣ್ಣಿಗೆ ತುಂಬಾ ಪ್ರಾತಿನಿಧ್ಯತೆ ಇದೆ ನಮ್ಮ ದೇಶದಲ್ಲಿ. ಹೆಣ್ಮಕ್ಕಳು ಅಂತಂದ್ರೆ ಒಂದು ಪಶು ಸಂಗೋಪನೆ ಅಂತಕ್ಕಂಥ ಒಂದು ಕಾನ್ಸೆಪ್ಟ್ ಬರೋಕ್ಕಿಂತ ಮೊದಲು ಇತಿಹಾಸದಲ್ಲಿ ನೋಡಿದ್ರೆ ಸಂತಾನೋತ್ಪತ್ತಿಗೆ ಗಂಡು ಬೇಕಾಗಿರ್ತಕ್ಕಂಥ ಒಂದು ಅಭಿಮತ ಇತ್ತು. ಹಾಗಾಗಿ ಹೆಣ್ಣು ದೇವತೆಯಾಗಿದ್ಲು. ಅದು ತುಂಬಾ ದಿನಗಳವರೆಗೆ ಹಾಗೇ ಮುಂದುವರಿತು. ಹೆಣ್ಣಿಗೆ ಅಷ್ಟು ಪ್ರಾಮುಖ್ಯತೆ ಇತ್ತು ನಮ್ಮಲ್ಲಿ. ಅದಾದ ನಂತರ ಅನೇಕ ಈಜಿಪ್ತಿಯನ್ ಸಿವಿಲೈಸೇಷನ್ ಬಂದ ಮೇಲಿಂದ, ಅರೇಬಿಯನ್ ಸಿವಿಲೈಸೇಷನ್ ಬಂದಾಗಿಂದ ಸ್ವಲ್ಪಿಗೆ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ನಮ್ಮ ದೇಶದಲ್ಲಿ ಕೂಡ ಅನಾದಾರ ಶುರುವಾಯಿತು. ಯಾವತ್ತು ಗಂಡು ದೇವತೆಗಳು ಹುಟ್ಟುಕೊಂಡು ಅವತ್ತಿಂದ ಹೆಣ್ಣು ದೇವತೆಗಳು ಸ್ವಲ್ಪ ಹಿಂದಕ್ಕೆ ಹೋದವು ಅನಿಸ್ತದೆ. ಆದ್ರೂ ಕೂಡ ಪ್ರಪಂಚ ಇತಿಹಾಸದಲ್ಲಿ ಹೆಣ್ಣಿಗೆ ಅತ್ಯಂತ ಉತ್ಕೃಷ್ಟವಾದ ಒಂದು ಸ್ಥಾನಮಾನ ಕೊಟ್ಟಿದ್ದು ಭಾರತ ದೇಶ ಅಂತ ಹೇಳಿ ನಾನು ಇಷ್ಟಪಡ್ತೀನಿ. ಇದೆಲ್ಲ ಯಾಕೆ ನಾನು ಮಾತಾಡ್ತೇನೆ ಅಂತಂದ್ರೆ, ಇನ್ಮೇಲೆ ನಾವು ಹಳೆಯದನ್ನ ಮತ್ತೆ ಮರುಕಳಿಸಾಗಿ ಮಾಡ್ಬೇಕು. ಈಗ ನೀವೇ ಹೇಳಿದ್ರೆ ತುಂಬಾ ಜನ ಹೆಣ್ಮಕ್ಳು ತುಂಬಾ ಕೆಲಸ ಮಾಡ್ತಾವ್ರೆ, 60% ವರೆಗೂ ಇದಾರೆ ಇವಾಗ ಪ್ರೋಗ್ರಾಮ್ ಕೆಲಸ ಮಾಡ್ತಾರೆ. ಇದೆಲ್ಲವೂ ನಮ್ಮ ಹೆಮ್ಮೆಯ ವಿಷಯನೇ. ಸೂಕ್ಷ್ಮ ವಿಷಯಗಳು ಕೂಡ ನಾವು ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ. ಹೆಣ್ಮಕ್ಳು ಎಲ್ಲಾ ಕಡೆ ಬರ್ತಾ ಇದ್ದಾರೆ, ಇದು ಒಳ್ಳೆ ಸಂಕೇತ, ಒಳ್ಳೆ ಸಂದೇಶ ಕೂಡ. ಇವತ್ತು ಕೂಡ ನನ್ನ ಜೊತೆಗೆ ನನ್ನ ಹೆಂಡತಿ ಕೂಡ ಇದ್ಲಿ ಇವತ್ತೆಲ್ಲ. ಅವಳು ಮೆಡಿಕೋ ಅಲ್ಲ, ಎಲ್ಲದನ್ನ ಕರೆಕ್ಟ್ ಆಗಿ ಕೇಳಿಸ್ಕೊಂಡ್ಲು. ಹಾಗೆ ಈ ವಿಷಯ ಎಲ್ರಿಗೂ ಕೇಳುತ್ತೆ, ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ ಹೋಗುತ್ತೆ. ತುಂಬಾ ಸಂತೋಷ ನೀವೆಲ್ಲ ಕೂತಿದ್ದು ಮಾತಾಡಿದ್ದು. ನಾನಂತೂ ತುಂಬಾ ಹೆಣ್ಮಕ್ಕಳ ಪರವಾದ ಘೋಷಗಳಲ್ಲಿ ಭಾಗವಹಿಸ್ತಾ ಇದ್ದೆ ಮೊದಲು. ಇತ್ತೀಚೆಗೆ ನಾನು ಸ್ವಲ್ಪ ಕಡಿಮೆ ಮಾಡಿದ್ದೀನಿ, ಯಾಕೆಂದ್ರೆ ತುಂಬಾ ಮಾತಾಡ್ಬಿಟ್ಟೆ ಮೊದಲೆಲ್ಲ. ನಾನು ಕಾಲೇಜ್ ಡೇಸ್ ಅಲ್ಲಿ ಇರ್ಬೋದು, ಅಲ್ಲಿ ಹೊರಗೆ ಬಂದ್ಮೇಲೆ ಕೂಡ ತುಂಬಾ ಮಾತಾಡ್ತಾ ಇದ್ದೆ ನಾನು. ಇವತ್ತು ಕೂಡ ಮಾತಾಡ್ತೀನಿ ಕೊಟ್ರೆ, ಆದ್ರೆ ನೀವೆಲ್ಲ ಮಾತಾಡ್ತಾ ಇರಲ್ಲ, ಅದಕ್ಕೆ ನಾನು ಬರಲ್ಲ ಮಾತಾಡ್ಲಿಕ್ಕೆ. ನೀವು ನನ್ನ ಪರವಾಗಿ ನೀವು ಮಾತಾಡ್ತಾ ಇದ್ದೀರಿ. ಇಷ್ಟು ಹೇಳಿಬಿಟ್ಟು ನೀವು ಏನ್ ಇವತ್ತು ಹೇಳಿದ್ರಲ್ಲ, ಇದೆಲ್ಲ 12ನೇ ಶತಮಾನದಲ್ಲಿ ಡಿಸ್ಕಷನ್ ಆಗಿತ್ತು. ಅಂದ್ರೆ ನೀವು ಇತ್ತೀಚೆಗೆ ಇದೇ ವುಮೆನ್ಸ್ ಡೇ ಮೆಮೊರಿಗೋಸ್ಕರನ ಡಾಕ್ಟರ್ ಎಚ್ ಅವ್ರು ಬರ್ತಕ್ಕಂಥ ಮಹಾದೇವಿ ಅಕ್ಕ ಪುಸ್ತಕ ತೆಗೆದು ಓದಿ. ನಾನು ಅರ್ಧಬರ್ಧ ಓದಿ ಏನಾಗಲೇ, ಇನ್ನು ಮುಗಿಸ್ತಾ ಇದ್ದೀನಿ. ಬೆಳಕಿನೊಳಗ ಮಹಾದೇವಿ ಅಕ್ಕ ಅಂದ್ರೆ ಅಕ್ಕ ಮಹಾದೇವಿಯ ಒಂದು ಕಥನವನ್ನ 12ನೇ ಶತಮಾನದ ಟೈಮಲ್ಲಿ, ಅಂದ್ರೆ ಬಸವಣ್ಣ ಹುಟ್ಟಿದ ಟೈಮಲ್ಲಿ, ವಚನಕಾರರ ಟೈಮಲ್ಲಿ ಯಾವ ರೀತಿ ಹೆಣ್ಣು ಮಕ್ಕಳು, ಹೆಣ್ಣಿನ ಪ್ರಾಮುಖ್ಯತೆ, ಯಾವ ರೀತಿ ಹೆಣ್ಣು ಮಕ್ಕಳು ಬೆಳೆದು ಬಂದ್ರು, ಯಾವ ರೀತಿ ಹೆಣ್ಮಕ್ಳು ಪ್ರಶ್ನೆ ಕೇಳ್ತಾ ಇದ್ರು, ಅನುಭವ ಮಟ್ಟದಲ್ಲಿ ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ಎಷ್ಟು ಪ್ರಾತಿನಿಧ್ಯ ಇತ್ತು, ಎಲ್ಲವುದನ್ನು ಕೂಡ ಸೂಕ್ಷ್ಮ ವಿವರಗಳೊಂದಿಗೆ ಬರೆದಿದ್ದಾರೆ. ದಯವಿಟ್ಟು ತಾವೆಲ್ಲ ಅದನ್ನು ಓದಿ. ಇವತ್ತು ನಿಮ್ಮವರೇ ಆದ ಒಬ್ಬ ವೈದ್ಯರು, ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಒಬ್ಬ ನಂಟಸ್ತಿಗೆ ಇರತಕ್ಕಂಥ ವೈದ್ಯರು ತುಂಬಾ ವಿವರವಾಗಿ ಬರೆದಿದ್ದಾರೆ. ದಯವಿಟ್ಟು ಓದಿ ಇನ್ನೊಬ್ರಿಗೂ ಓದಿಸಿ. ನಿಮ್ಮೆಲ್ಲಾ ಪ್ರಶ್ನೆಗಳಿಗೂ ಉತ್ತರ ಸಿಗುತ್ತೆ. ಇಂದು ನೀವೆಲ್ಲ ಹಕ್ಕುಗಳು ಹೇಳಿದ್ರಿ, ಅವತ್ತೇ ಡಿಸ್ಕಸ್ ಮಾಡಿದ ಹಕ್ಕುಗಳನ್ನ. ಆವತ್ತಿನ ದಿನದಲ್ಲಿ ಬಸವಣ್ಣನ ತನ್ನ ಮಾತುಗಳನ್ನ ಹಿಂಪಡಿಲಿಕ್ಕೆ ಎಷ್ಟೋ ಸರ್ತಿ ಅಕ್ಕಮಹಾದೇವಿ ಕಾರಣ ಆಗಿದ್ಲು. ಅನುಭವ ಮಂಟದಲ್ಲಿ ಬಸವಣ್ಣನ ಅನೇಕ ಅಭಿವ್ಯಕ್ತಿ ವಿಷಯಗಳನ್ನ ಹೆಣ್ಣು ಮಗಳಾಗಿ ಅಕ್ಕಮಹಾದೇವಿ ಬದಲಾಯಿಸಿದ್ಲು ಅಂತಕ್ಕಂಥ ಎಷ್ಟೋ ವಿಷಯಗಳಲ್ಲಿದ್ದಾವೆ. ಹೀಗಾಗಿ ನಾವು ಭಾರತೀಯರಾಗಿ ತುಂಬಾ ಏನಂತಾರ ಅಭಿಮಾನ ಪಡಬೇಕು. ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ನಾವು ಮೊದಲಿಂದನೂ ಅತ್ಯಂತ ಎತ್ತರ ಸ್ಥಾನದಲ್ಲಿ ಇಟ್ಟಿದೀವಿ. ಅದನ್ನ ನೀವಿನ್ ಮಾಡಿ ತೋರಿಸ್ತಾ ಇದ್ರಿ. ನಾವು ಇನ್ನು ಮಾತಾಡೋದು ಬೇಕಾಗಿಲ್ಲ, ನೀವು ಮಾತಾಡ್ಬೋದು, ನಮಗೆ ನೀವು ಪಾಠ ಹೇಳ್ಕೊಡ್ಬೋದು ಅಂತ ಹೇಳ್ತಾ, ವಿಶೇಷವಾಗಿ ಬಂದಿರತಕ್ಕಂಥ ದೀಪಾ ಅವರಿಗೆ, ಅಂದ್ರೆ ಅವರು ನಮ್ಮ ವೈದ್ಯಕೀಯ ಸಂಪರ್ಕದಲ್ಲಿ ಇಲ್ಲ, ಹಾಗಾಗಿ ನಾನು ಅವರಿಗೆ ವಿಶೇಷವಾಗಿ ಅಭಿನಂದನೆ ಸಲ್ಲಿಸ್ತೀನಿ. ನಿಮ್ಮಂತವರೆಲ್ಲ ಇರ್ಬೇಕು ಸೊಸೈಟಿಯಲ್ಲಿ, ಸಮಾಜದಲ್ಲಿ. ನಮ್ಮ ಮನ್ಪ್ರೀತ್ ಕೌರ್ ಇದ್ದಾರೆ, ವೀಣಾ ಮೇಡಮ್ ಇದ್ದಾರೆ, ಪದ್ಮ ಪ್ರಕಾಶ್ ಅವರು ಇದ್ದಾರೆ. ನೀವೆಲ್ಲರೂ ಕೂಡ ಸಾಕಷ್ಟು ವಿಚಾರವನ್ನು ಹೊಂದಿದಿರಿ. ನಿಮ್ಮ ಫೀಲ್ಡ್ ಬಿಟ್ಬಿಟ್ಟು ಬೇರೆ ಫೀಲ್ಡ್, ಅಂದ್ರೆ ಡಾಕ್ಟರ್ಸ್ ಬಿಟ್ಬಿಟ್ಟು ಬೇರೆ ವೃತ್ತಿಗೆ ಹೋಗಿ ಅಲ್ಲಿ ಮಾತಾಡಿ, ಹೆಣ್ಮಕ್ಳು ಸರ್ಕಲ್ ಬಿಟ್ಬಿಟ್ಟು ಗಂಡ್ಮಕ್ಳು ಸರ್ಕಲ್ಗೆ ಹೋಗಿ ಮಾತಾಡಿ ಸಾಕಷ್ಟು ವಿಷಯಗಳನ್ನ ಚರ್ಚೆ ಮಾಡಿ ಅಂತ ಹೇಳ್ತಾ, ತುಂಬಾ ಅಭಿಮಾನದಿಂದ ನಾನು ಇವತ್ತು ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಿದೆ. ನಾನು ತುಂಬಾ ಕಷ್ಟ ಬಿದ್ದು ಬಂದೀನಿ ಇವತ್ತು ಕೂತ್ಕೊಳ್ಳಿಕ್ಕೆ ಇಲ್ಲಿ, ಆದ್ರೂ ಕೂಡ ತುಂಬಾ ಸಂತೋಷ ಆಯ್ತು. ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು ಮೇಡಮ್. ನಮಸ್ತೆ.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಥ್ಯಾಂಕ್ ಯು.
ನಮಸ್ತೆ ಸರ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್ ನಿಮ್ಮ ಮಾತುಗಳಿಗೆ. ಎಲ್ಲಿ ನಾರಿಗೆ ಪೂಜೆ ಆಗುತ್ತೋ ಅಲ್ಲಿ ದೇವತೆಗಳು ವಾಸಿಸ್ತಾರೆ ಅನ್ನುವಂಥದ್ದು ಮನುಸ್ಮೃತಿಯ ಮಾತು. ಹಾಗೆ ಎಲ್ಲಿ ಹೆಣ್ಣು ಮಕ್ಕಳನ್ನ ಆರಾಧಿಸ್ತಾರೆ, ಗೌರವಿಸ್ತಾರೆ, ಅಲ್ಲಿ ಸಮಾಜ ಮುಂದುವರಿತದೆ, ಒಳ್ಳೇದಾಗುತ್ತೆ ಅನ್ನುವಂತ ನಿಮ್ಮ ಮಾತುಗಳು ನಮ್ಗೆಲ್ಲ ಸ್ಫೂರ್ತಿ. ಪ್ರಶ್ನೆಗಳು ಅಂತ ಯಾವ್ದು ಇಲ್ಲ, ಕೇಳೋದಿದ್ರೆ ಯಾರಾದ್ರೂ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡು ಕೇಳ್ಬೋದು.
ನಮ್ ಜೊತೆಗೆ IMAKSB ಡಾಕ್ಟರ್ ಮಸೂದ್ ಕಾರಿನೂರ್ ಸರ್, ಮಧು ಸರ್, ಸರ್
ಈಗ ಇಲ್ಲ ಸರ್, ಹಾಗೆ ಈಗಿಲ್ಲ.
ಓಕೆ. ಅನಿಸಿಕೆಗಳನ್ನು ಹೇಳಬೇಕು. ರಾಜಶ್ರೀ ಅನಾಗೋಳ್ ಮೇಡಮ್ ಇದ್ರಲ್ಲ,
ರಾಜಶ್ರೀ ಮೇಡಮ್ ಇದ್ದಾರೆ. ಮೇಡಮ್ ಮಾತಾಡಿ ಮೇಡಮ್.
ಏನ್ ಮಾತಾಡ್ಬೇಕ್ರಿ ಮೇಡಮ್?
ಅಭಿಪ್ರಾಯ ಮೇಡಮ್ ಲಾಸ್ಟ್
Okay. Yeah. It's a very informative session. The three speakers, they talk very nicely, and that is, I think, it's need of hour, because the cervical cancer is very rampant, and if it detects early, then the treatment is also very easy, and means it is effective. And Dr. Padma Prakash Rao, she has also talked about the women's health and the society. The talk was very nice and informative. And Mrs. Deepa, Advocate Deepa, she has given the what is the women's right in the society. The webinar is very good, and thank you very much.
Okay, thank you. ವಿಜಯಲಕ್ಷ್ಮಿ ಮಾತಾಡ್ತಾ, ವಿಜಯಲಕ್ಷ್ಮಿ ಮೆಸೇಜ್ ಹಾಕ್ತಾ ಇದ್ರು. ವಿಜಯಲಕ್ಷ್ಮಿ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡು ಮಾತಾಡಿ. ವಿಜಯಲಕ್ಷ್ಮಿ ಹೇಮಾಡೀಸ್ ಯಾರು ಮಾತಾಡ್ಬೋದು ಬೇಕಂದ್ರೆ. ಇಲ್ಲ. ಸುಧಾರಾಣಿ ಮೇಡಮ್, ಡಾಕ್ಟರ್ ಸುಧಾರಾಣಿ.
ಹಲೋ, ಸಂಧ್ಯಾ ರಾಣಿ ಮೇಡಮ್, ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಮೇಡಮ್, ನೀವು ಆರ್ಗನೈಸ್ ಮಾಡಿದೀರಾ, ಇಲ್ಲಿ ನೀವು ಆರ್ಗನೈಸ್ ಮಾಡಿರೋಂತ ಪ್ರೋಗ್ರಾಮ್ ನ ಇನ್ನೂ ಸ್ವಲ್ಪ ಬೇಗ ವಾಟ್ಸಪ್ ಅನ್ನ ಅಂದ್ರೆ ವಾಟ್ಸಪ್ ಮೂಲಕ ಒಂದಷ್ಟು ಜನಕ್ಕೆ ಸಮಾಜದಲ್ಲಿ ನೀವು ಲಿಂಕ್ ಕೊಟ್ರೆ ಹೆಚ್ಚೆಚ್ಚು ಜನರು ಈ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ಅಲ್ಲಿ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಅವಕಾಶ ಆಗುತ್ತೆ, ಮತ್ತೆ ಅವ್ರಿಗೂ ನಿಮ್ಮ ವಿಷಯ ಮುಟ್ಟುತ್ತೆ ಮೇಡಮ್. ಹಾಗಾಗಿ ಮೊದ್ಲೇ ಪ್ರೀ ಪ್ಲಾನ್ ಮಾಡಿ ನೀವು ಅಂದ್ರೆ ಶಾರ್ಟ್ ಟೈಮ್ ಮಾಡಿದೀರಾ, ಮೊದ್ಲೇನೆ ಇನ್ನೂ ಒಂದಷ್ಟು ಕಡೆ ಇದನ್ನ ಪ್ರಚಾರ ಮಾಡಿದ್ರೆ ಸೊ ದಟ್ ಬೇರೆಯವರೆಲ್ಲ ತುಂಬಾ ಜನ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡ್ಬೋದು ಅಂತ ನನಗನ್ಸುತ್ತೆ.
ಯೂಟ್ಯೂಬ್ ನಲ್ಲಿ ಕಣ ಮೇಡಮ್ ಲಿಂಕ್ ಹಾಕ್ತಿವಿ, ಅದನ್ನ ಎಲ್ಲರಿಗೂ ಕಳಿಸ್ಬೋದು. ಯೂಟ್ಯೂಬ್ ಲಿಂಕ್ ಕೊಡ್ತೀವಿ,
ಬಟ್ ಲೈವ್ ಅವರು ಅಟೆಂಡ್ ಮಾಡಿದ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ ಮೇಡಮ್.
Thank you very much madam.
Suggestion madam.
Okay.
ನಮ್ಮ ಜೊತೆಗೆ ಇವರು ಡಾಕ್ಟರ್ ಕರುಣಾಕರ್. ಹಲೋ ಡಾಕ್ಟರ್ ಕರುಣಾಕರ್ ಸರ್.
No, he is not there, sir.
Okay. ದೀಪಾ ಮೇಡಮ್ ಗೆ
sir voice
ಮೇಡಮ್ ತಮಗೆ ತಮ್ಮ ವಿಳಾಸ ಮತ್ತು ಮೊಬೈಲ್ ನಂಬರ್ ಹೇಳಿದ್ರೆ ವೀಕ್ಷಕರಿಗೆ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಏನಾದ್ರು ಪ್ರಶ್ನೆಗಳು ಕೇಳೋದಿದ್ರೆ ಆಮೇಲೆ ಕೂಡ ಅವ್ರು ಕೇಳಬಹುದು. ತಮ್ಮ ವಿಳಾಸ ಹಾಗೂ ಮತ್ತು ಮೊಬೈಲ್ ನಂಬರ್.
ಖಂಡಿತ ಸರ್, ಇವಾಗ ಮೊಬೈಲ್ ನಂಬರ್ ನೋಟ್ ಮಾಡ್ಕೊಳ್ಳಿ.
ಹೇಳಿ ಮೇಡಮ್.
95 ಹೇಳ್ಬೋದಾ ಸರ್?
ಹಾ ಹೇಳಿ ಮೇಡಮ್.
ಆಗ್ತೀನಿ ನಾನು. ಯು ಟೆಲ್.
9538.
ಹಾ ಮೇಡಮ್.
61 00 76 76. ನಾನು ಆಲ್ಮೋಸ್ಟ್ ಹೈಕೋರ್ಟ್ ಅಲ್ಲಿ ಇರ್ತೇನೆ. ಸೊ whenever they want they can call me and come and meet me.
ಓಕೆ ಮೇಡಮ್. ನಮ್ಮ IMA KSP ವತಿಯಿಂದ ತಮಗೆ ಮತ್ತೊಮ್ಮೆ ಧನ್ಯವಾದಗಳನ್ನು ತಿಳಿಸ್ತೇವೆ ಮೇಡಮ್. ಆಮೇಲೆ ಇನ್ನೊಂದು IMA KSP ವತಿಯಿಂದ ಏನಾದ್ರೂ ಮೆಡಿಕಲ್ ಆರ್ ಲೀಗಲ್ ಆಸ್ಪೆಕ್ಟ್ ಇದ್ರೆ ಸಂಕೋಚ ಇಲ್ಲದೆ ತಮ್ಮ ಹತ್ರ ಬಂದು ಅನೇಕ ಸಮಸ್ಯೆಗಳು ಇವತ್ತಿನ ದಿನ ಮಹಿಳೆ ಅಷ್ಟೇ ಅಲ್ಲದೆ ಅನೇಕ ಸಮಸ್ಯೆಗಳು ಇವತ್ತು ವೈದ್ಯ ಲೋಕದಲ್ಲಿ ತಮಗೆ ಗೊತ್ತಿದ್ದಂಗೆ ನಮಗೆ ಇವತ್ತು ಹಾಸ್ಪಿಟಲ್ ಹರಾಸ್ಮೆಂಟ್ ಆಗಿರ್ಲಿ, ವೈದ್ಯರ ಮೇಲೆ ಹರಾಸ್ಮೆಂಟ್ ಆಗಿರ್ಲಿ, ಇನ್ನುಳಿದ ಅನೇಕ ಸಮಸ್ಯೆಗಳು ಇವತ್ತು ಸವಾಲಾಗಿದ್ದಾವೆ. ಸೊ ಅಂತ ಸಮಸ್ಯೆಗಳಿಗೆ ನೀವು ನಮ್ಮವರ ಅಂತ ಕೂಡ ನಾವು ನಿಮಗೆ ಟಚ್ ನಲ್ಲಿ ಇರ್ತೀವಿ ಅಂತ ಹೇಳ್ಕೊಂಡು ತಮ್ಮ ನಂಬರ್ ನ ನೋಟ್ ಮಾಡ್ಕೋತೀವಿ ಮೇಡಮ್.
ಖಂಡಿತ ಬನ್ನಿ ಸರ್.
ನಮ್ಮಲ್ಲಿ ಕೂಡ ಮೇಡಮ್ ನಮ್ಮಲ್ಲಿ ಕೂಡ ಮೆಡಿಕಲ್ ಲೀಗಲ್ ಸೆಲ್ ಇದೆ, ಓನ್ಲಿ ಡಾಕ್ಟರ್ ಸುಲಭ ಇದೆ. ಸೊ ತಮ್ಮ ಜೊತೆಗೆ ನಾವು ಕೂಡ ಹಂಚ್ಕೋತೀವಿ ಕೆಲವೊಂದು ವಿಷಯಗಳನ್ನ ಅಂತ ಹೇಳ್ಕೊತ ವಂದನೆಗಳು ಮೇಡಮ್. ಮತ್ತೊಮ್ಮೆ ವೀಣಾ ಮೇಡಮ್ ಏನಾದ್ರು ಹೇಳೋದಿತ್ತ?
ಕಾರ್ಯಕ್ರಮವನ್ನ ಚೆನ್ನಾಗಿ ನಡೆಸ್ಕೊಟ್ಟಂತ ಮನ್ಪ್ರೀತ್ ಮೇಡಮ್ ಅವರಿಗೆ, ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಮೇಡಮ್ಗೆ, ದೀಪಾ ಅವರಿಗೆ ಎಲ್ಲರ ಪರವಾಗಿ ಅನಂತ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳ್ತೇವೆ. ಸಕ್ರಿಯವಾಗಿ ಭಾಗವಹಿಸಿದ ಎಲ್ಲ ಸದಸ್ಯರಿಗೆ, ವೈದ್ಯ ಮಿತ್ರರಿಗೆ ಹಾಗೂ ಎಲ್ಲ ಇವರು ದೀಪಾ ಮೇಡಮ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಗಳಿಗೆ ಎಲ್ಲರಿಗೂ ಕೂಡ ಅನಂತ ಧನ್ಯವಾದಗಳು. ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿದ ಎಲ್ಲ ವೈದ್ಯರಿಗೂ ಕೂಡ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳ್ತಾ ಮುಂದಿನ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಫಾರಂ ನ ಕಾರ್ಯಕ್ರಮಗಳಿಗೆ ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತಿಸ್ತಾ ಕಾರ್ಯಕ್ರಮವನ್ನ ಕೊನೆಗೊಳಿಸ್ತಾ ಇದ್ದೇವೆ. ಶುಭರಾತ್ರಿ. ನಮಸ್ತೆ.
ನಮಸ್ಕಾರ.
Thank you so much.
Thank you so much.
Thank you.
Thank you.